members of the board.
Afternoon.
Good afternoon. It's 2:00 p.m. and today's Tuesday, September 22nd. My name is Brian Zumwalt. I'm the director of the county's Office of Technology and Innovation. I'll be playing the role of technology moderator for today's virtual meeting. On the panel with me is Don Kroll from the county attorney's office, who will be serving as process moderator. Before we get started, as usual, we'll do a quick roll call and make sure we've got adequate communications for each commissioner. And we'll start today with Commissioner Eggers.
Good afternoon, Brian. I'm here.
Thank you, sir. Commissioner Seal.
Good afternoon.
Good afternoon. Thank you. Commissioner Welch.
Good afternoon, Brian.
Thank you, sir. Commissioner Long. And Commissioner Long was there a minute ago. We'll go back to her. I don't see her in the picture right now. How about Commissioner Justice?
Good afternoon, Brian.
Good afternoon. Commissioner Peters.
I'm here. Good afternoon, Brian.
And Commissioner Gerard.
Good afternoon, everyone. We will start this meeting. I'd like to rearrange the schedule a little bit just because we have our doctors coming and they will be online at 2:30. So we're going to, and I need to be off this meeting by 3:15. So we will go through the agenda, wait for them to do their presentation, and then have public comment. However, we can do the consent agenda and do whatever items we can get in before they come online. So, our consent agenda is items 2 through 16. Does anything need to be pulled? Yes, Commissioner.
Yeah, I was going to ask, I think we talked about it on Thursday, pulling 13 and 14
Okay.
to get an update on both of those. Thank you.
Staff is available to provide that update.
Okay.
I'll move the balance, Madam Chair.
Thank you. Do we have a second?
Second.
If we have anybody who would like to comment on the consent agenda, please do so now. Brian?
From the public, thank you, Madam Chair. At this time, if there are any members of the public that wish to comment on the consent agenda, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And just for everybody in the public, I'm going to go ahead and reset all the hands and lower all the hands, and we'll get back to the state of emergency when later. But for right now, anybody on the consent agenda that wishes to speak, please go ahead and raise your hand. And Madam Chair, we do have one person that wishes to speak. I only have Tracy as a first name. So Tracy, if you'll go ahead and unmute yourself and give us your first, last name, spelling, and address for the record, you'll have 3 minutes to address the board.
Hi, good afternoon. I'm sorry, did I miss that you changed what we would be commenting on right now?
Correct. Right now is comment on the consent agenda is what comment is on at this moment.
My apologies, I'm for the state of emergency.
Okay, we need to delay that a little bit. So. Okay.
Madam Chair, we do have one other speaker that wishes to speak on the consent agenda, Mr. Dave Waddell.
Okay.
Mr. Waddell, go ahead and unmute yourself and give us your spelling and address for the record. You'll have 3 minutes to address the board.
David Waddell, W-A-D-D-E-L-L. I'm not going to give you my address because I've gotten some veiled threats. What I'd like to do is confirm that the citizens to be heard and the consent or the local state of emergency are two separate agenda items. Is that correct?
We will be taking comment once on the local state of emergency. You can, of course, anything else on the agenda, you can comment on when that item comes up.
I guess my question is, are we once again combining citizens to be heard with the local state of emergency agenda items?
Yes, we are.
So again, if you've got other issues besides the citizens to be heard, I mean, I know directively I have things to say about the local state of emergency, but it sort of washes out your opportunity because there's another item I'd like to speak to, and it doesn't allow me to do both. And I'm wondering what is proper procedure, and maybe County Attorney Joel White can help us with this, because if we're combining citizens to be heard and the local state of emergency, now we've lost the opportunity of 3 minutes to speak And I know you guys have had an onslaught of people wanting to speak, and I did speak with a commissioner recently about a way that we could work this out where by email in advance so that you guys knew what the responses were going to be, we could plan accordingly. And then the doc's only coming in for 45 minutes today. Well, that concerns me because my goodness, you know, we're not even halfway through this yet. So I'd like to be heard under both citizens to be heard and under the declaration of the state of emergency. And I don't think combining the two gives us an opportunity for input. Thank you.
Thank you.
Madam Chair, we do have one other speaker with their hand up on the consent agenda, Dr. Elena Levine. Dr. Levine, if you go ahead and unmute yourself and give us your spelling and address for the record, you'll have 3 minutes to address the board. And Dr. Levine, you'll have to unmute on your side.
I'm sorry, I misunderstood. And tell me if I'm correct that we're now waiting to speak about the state of emergency?
Correct.
Okay, then I have nothing else to say.
Probably
I just
closer to
thank you
3
for,
o'clock.
yeah, and I don't know that I'll make it till then. You know what I feel. And I absolutely thank you all for all of the care you're taking to protect us. That's all.
Okay, thank you.
Madam Chair, there are no other speakers on the consent agenda.
Okay, well, we have a motion by Commissioner Welch, second from Commissioner Eggers. All in favor, please raise your hand. Thank you. Item carries unanimously. Well, I think Commissioner Peters is not there. So, okay. 6-0. Item 13, Commissioner.
Yeah, thank you. And I think Barry, we talked again about just getting an update on Lakeshore Estates Phase 2, where we are in the process would be helpful, as well as on the next item, number 14. So I don't have any opposition to either one, but I just really wanted an update from staff. Thank you.
For the public's purpose, this is an award of bid to Keystone Excavators for the Lakeshore Estates Phase 2 roadway and drainage improvement project. And our Public Works Director, Kelly Levy, will provide an update for you.
Good afternoon. After the approval of the contract today, we'll be finalizing the agreement with the contractor and scheduling the pre-construction meeting. We are planning for a community pre-construction meeting in January of 2021, similar to what we did with the West Winds Crosswinds Bridge project, so that everyone has a good idea of how the project is going to proceed, how it's going, the phasing of the project, so that we're minimizing the amount of disruption at any one time. So we're going to have a lot of community outreach with this phase in advance of the construction.
And Kelly, so at this, do we have any kind of general estimate as to when it would start and kind of the length of it? I know that you're going to get in that when you talk to the contractor probably later this year, but do we have any sense just a kind of what they're going to be going through, the residents in that area, when they expect to start it and when they expect to finish?
With a community meeting in January, I believe we'll approximately start about 30 days after that. So then it would be under construction for, I think it's about, I'm not sure what sorry, I don't know what the construction timeline is on that, but I know it's over a year. So it is going to be a lot of disruption. But what we are asking the contractor to do is phase it so that it's not the phase 1. They came in and, you know, everything was torn up all at once. And that was part of the problem. So when we put this out to bid this time, the contractors went in knowing that it's going to be phased so that we're not tearing up the entire community all at once. And so that will all be presented to the community with timelines so that they have a general understanding of how the project is going to proceed.
Okay, that's great, Kelly. Thank you. And just they'll know that this is going to be pretty much a calendar 2021 and then a little bit into 2022 probably. But yeah, at this point, and they'll get more details later. So that's great news. And so I would move approval on this item.
Second.
Okay, any other questions?
Did you want to do them both at the same time, or do you want to do them separately? I mean,
let's just do them separately. We have a motion from Commissioner Eggers, second from Commissioner Welch. All in favor, please raise your hand. Thank you. Item passes unanimously. Item 14.
This also is an award of a bid to Keystone Excavators for a water main improvement project on alternate 19 from Omaha Street to Delaware Avenue. And Megan Ross, our Director of Utilities, is on the line to be able to answer the questions you had last week regarding this project.
Hi, good afternoon, Madam Chair and members of the board. As Barry stated, the area of the project is in Palm Harbor around the alternate 19 area. This is a drinking water system and infrastructure upgrade, and this will result in a total of over 1 mile of water pipe being upgraded in addition to some new fire hydrants in the area. Community outreach for this project will include a public-facing project webpage, notifications and updates posted on social media, and door hangers for customers in the area. And additionally, a virtual informational meeting will be held in Zoom for the project. We anticipate providing weekly updates throughout construction, and this will be posted on our project webpage for customers to be updated on throughout construction. And we anticipate starting construction in December of this year, and it'll take about a year for completion. So December of 2021 is our anticipated completion date.
Okay, that's great. And then you'll have more details on that as well at the community gathering.
Absolutely, yes.
Perfect. Thank you. I appreciate that. Move
Thank you.
approval.
Second.
Okay, we have a motion from Commissioner Eggers, second from Commissioner Welch. Commissioner Seal, did you have a question, or you're seconding? Okay. All right, if there are no questions, all in favor say aye. Or
Aye.
your hand,
Aye.
sorry. Thank you. Item carries unanimously.
Madam Chair,
Yes. Commissioner Justice, yes.
thank you, Madam Chair. On it, there is an 11% SBE component, and we had talked at a previous meeting about getting a presentation, an updated presentation on the Small Business Enterprise Program. And since this was on the item, I was just curious if we've got that scheduled yet.
We're working on the schedule. We have it ready. We just have to fit it in with some of the other presentations coming up.
Okay, thank you.
Okay, great. So let's move to item 18 and come back to 17 when the doctors get here.
Okay, item 18 is fiscal year 2021 interlocal agreement between the Pinellas County Sheriff's Office and St. Pete Clearwater International Airport for law enforcement services.
Move approval.
Approval.
Okay. We have a motion from Commissioner Long, second from Commissioner Peters. Do we have any questions? Not all in favor, say aye or raise your hand. Aye. Thank you. Motion carries unanimously.
We need to take comment, citizen comment.
Sorry. Just keep me in line. Sorry.
At this time, if there are any members of the public that wish to comment on agenda item number 18, I'm going to go ahead and reset hands. And so if anybody has any comments on agenda item 18, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And Madam Chair, we do have one member of the public that wishes to speak, Mr. Dave Waddell. Mr. Waddell, you have 3 minutes to address the board.
Yes, once again, good afternoon. When I was growing up as a youngin', we had a pledge and a prayer every morning, and we used to have them during the meetings. We just passed 200,000 people that are dead, and their families are affected, and almost 700,000 people that are going to be affected probably for the rest of their lives. I almost want to just say the Pledge of Allegiance, if I may. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We just lost another icon, all right? And I know this is a bad situation for us all to be in, but we need prayer and we need allegiance to our country now more than ever. We're all Americans, okay? This divisiveness has got to end. And I'm sorry that I had to skip on this agenda item, but you know, people want to be heard. You're my therapy. knowing that you guys are in charge of things and we're all going to be okay makes a world of difference. So if we could open with a prayer and a pledge, I think that might help. Thank you.
Thank you.
Madam Chair, there are no other speakers on this agenda item.
Okay, we have a motion from Commissioner Long, second from Commissioner Peters. All in favor, please raise your hand. Thank you. Item 19.
This is an agreement to terminate an interlocal agreement for the Tampa Bay Advanced Manufacturing Industry Certification Training Center. This is the AmSkills. It had a 5-year window. That completes that 5-year window. You spend over $775,000 over that 5-year period, and it's now up on its own to a newly formed 501c3.
Move approval.
Second.
Okay, we have a, yes, Commissioner Seal, please. You were just moving? Can't hear you.
Commissioner Steele, your audio is not working. I think you might be connected to your Bluetooth. I'll get BTS to help her out.
Seems to be the day for it. Okay. Anybody else want to comment? All right. We have a motion from Commissioner Eggers, second from Commissioner Welch. All in favor, please raise your.
Citizen comment.
Public comment.
Citizen comment.
Sorry, I don't know why.
At this time, if there are any members of the public that wish to comment on agenda item number 19, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone, please. And Madam Chair, it doesn't appear there is anybody that wishes to comment on agenda item 19.
Okay. Thank you. Not sure what happened to Commissioner Seal, but those in favor, please raise your hand. Opposed? Motion carries 6-0, I guess. Item 20.
Item 20 is a data sharing agreement between the Florida Department of Economic Opportunity, the Board of Commissioners, and WorkNet Pinellas, i.e. CareerSource. This establishes confidentiality guidelines.
So moved.
Yes. Commissioner Peters, did you want to comment, or was that just a second?
Madam Chair.
Okay, thank you. All right. Do we have any comments on this, Brian?
At this time, if there are any members of the public that wish to comment on agenda item number 20, please hit *9 on the telephone or raise your hand virtually in the Zoom meeting. And Madam Chair, we have 2 members of the public that wish to speak on this item. Our first speaker is Anita Holyfield. Ms. Holyfield, if you can go ahead and unmute yourself and give us your first name, spelling, and address for the record. You'll have 3 minutes to address the board.
D period ANITA, last name HOLIFIELD, 1125 2nd Avenue South. My concern, which was not, unless I missed the documentation, it says there are no security protocols at all listed. So have you put those in place? And in the unfortunate circumstance that there is a data breach, how will it be addressed? Thank you.
Thank you.
Mike Meidel is on the line, Madam Chair, if you would like him to address that.
Who is?
Mike Meidel.
Oh, okay, great.
Give me one moment. I'm going to promote Mike. Mike, can you raise your hand, please? Oh, there you are. I'm sorry. I didn't see him in the list. Give me one moment, Madam Chair.
Thanks.
Mike, go ahead and unmute and turn on your camera. You should be good to go.
All right. Can you hear me?
Yes, sir.
There we go. Yes, this is an agreement with the Department of Economic Opportunity in Tallahassee, which is the same organization that runs the unemployment compensation, which in Florida is called reemployment assistance. And it's an agreement between the state and the local workforce board And because the county is the sort of the local elected official of the workforce grant and the federal program, we are a party to this agreement. We will not have access to this data ourselves. Only CareerSource staff and the DEO will have that relationship. And their security systems are set up by the state of Florida. In fact, the reason this entire agreement was put in place is to ensure the confidentiality of this data, because it does include social security numbers of the people applying for reemployment assistance. But again, in this case, the county will not have access to any of that data, and we're not a party to receiving that data. It will not be in our database systems. It will not come across our channels of communication in any form.
I also want to say, I know that CareerSource has an independent company that they're contracting with for data security, because they did have a breach last year, and they've gotten very serious about it. So,
Yeah.
All right, can we have our other speaker, please?
Yes, Madam Chair, our next speaker is Dave Waddell. Mr. Waddell, if you'll unmute yourself and give us your spelling and address for the record, you have 3 minutes to address the board.
Good afternoon once again. Since we're talking about economic development, I brought this up back in June already. We need to have adequate ventilation systems indoors, whether it be schools or businesses. And we also need to set aside funding for contact tracing, because based on the data that I'm seeing and the projections, we're probably going to be hit pretty hard. And I hate to say this, but I hope we don't have the Super Bowl, Mike. I don't know where you stand on that, but if we do, what we're doing is we're going to become a big petri dish, just like Miami did. So I don't know where we are from an economic development standpoint on, and I'm sure Commissioner Eggers would agree, if we looked at ventilation systems, we'd be appalled. This virus does become aerosolized. So when we start going back inside into restaurants, that momentary time when you're eating with your mask off or having a drink, chances are pretty darn good that you might get it. Maybe a healthy person would only get it and then become asymptomatic, but an asymptomatic person is worse than a symptomatic person. At least a symptomatic person knows, oh my God, I've got it. I don't need a test. All right. So I proposed back then on the county's emergency management app to piggyback a anonymous reporting by employers that are conducting business should one of their employees become sick.
You know, this is, Dave, you know, you should wait until we're talking.
I'm just saying, we're looking at economics here, and the impact's already proved itself. So, you know, I want to be proactive and plan ahead is what I'm trying to say.
Right.
And, you know, ventilation is going to be key here, whether it be filtration or UV. But Mike, it's going to create jobs. The HVAC guys are going to be real happy upgrading these systems. So, like I said, the first time in my life, I was here for the Super Bowl. Oh, I think it was back in 2002 or 3 or somewhere in there. And I couldn't afford to go. And I'd love to see the shot in the arm we all need, but we have to be proactive and plan ahead. Thank you. And it was an economic agenda item, and I'm talking economics. So if we can do it with this system and make it anonymous, we can certainly do it with contact tracing and mandatory reporting.
Thank you, Dave.
Thank you.
Madam Chair, there are no other speakers that wish to be heard.
Okay, well, we have a motion from Commissioner Welch, second from Commissioner Peters, I think. All in favor, please raise your hand. Thank you. Item 21.
This is an agreement with Directions for Mental Health, Inc., Operation PAR, and West Care, Gulf Coast, Florida, for a cooperative agreement to benefit homeless individuals. This provides services 270 clients. There's currently 110 clients active in the program. This is for next year's funding.
Move approval.
Second.
Thank you. Do we have any questions? Comments from the public?
At this time, if there are any members of the public that wish to comment on agenda item number 21, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And Madam Chair, it doesn't appear we have anybody that wishes to comment.
Okay, thank you. If there are no questions, all in favor, please raise your hand. Thank you. Item carries unanimously. Item 22.
This is an agreement with personal enrichment through mental health services. This is for our crisis stabilization unit and the Pinellas Integrated Care Alliance for a total budget not to exceed $2.1 million.
Move approval.
Second.
Okay, Commissioner Peters. Oh, was that sorry, that was a second. Okay. Do we have any commenters on the line?
At this time, if there are any members of the public that wish to comment on agenda item number 22, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And Madam Chair, we do have someone on the telephone line that wishes to speak. Last four digits 7868. If you can go ahead and unmute yourself and give us your first, last name, spelling, and address for the record, you'll have 3 minutes to address the board.
Hi, this is Deborah Kuhn. I was waiting to speak on the state of emergency.
Madam Chair, I'm sorry, you're muted. Commissioner Gerard, you're muted.
Sorry.
One moment.
Well, you go ahead, Brian.
So we've delayed that until later in the agenda. So if you can hang on for a few moments, we should be getting to that agenda item.
Oh, okay, thank you.
Thank you.
I'll remute, thanks.
Thank you.
Okay, for those who are on the line, we are waiting for our doctors to show up so that we can have a presentation from them before we take public comment. So thank you for waiting. All right, we have a motion from Commissioner Long, second from Commissioner Welch. If there are no further questions, all in favor, please raise your hand. Item carries 7-0. Thank you. Item 23, I'm sorry.
Item 23 is a grant award with the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Services Administration. This is for assisted outpatient treatment services for individuals with serious mental illness. Again, this is a 3-year grant. There's no local match.
Move approval, Madam Chair.
Second.
Second.
Okay. Do we have any comments on this?
At this time, if there are any members of the public that wish to comment on agenda item number 23, please hit *9 on the telephone or raise your hand virtually in the Zoom meeting. And Madam Chair, we do have one person that wishes to comment coming in on the phone line, last four digits 4945. If you can go ahead and unmute and give us your first, last name, spelling, and address, you'll have 3 minutes to address the board.
Hey, this is David Happy. I wasn't paying attention. Is this the state of emergency at this point?
Mr. Happy, we've delayed the state of emergency until later in the agenda, Mr. Happy. So if you would go on mute, we'll have it in a few moments here.
Okay, sounds great. Thank you.
Thank you, sir.
Thank you. Okay, if there's no one else.
No, ma'am.
Any questions from the commission? Not all, we have a motion from Commissioner Peters, second from Commissioner Welch. All in favor, please say aye or raise your hand.
Aye.
Thank you. Commissioner, item 24.
This was an interlocal agreement with the Public Defender's Office for a jail diversion, juvenile crossover case managers, and a therapist for the Ready for Life program and an information technology position within the Public Defender's Office.
So moved.
Second.
Okay. We have a motion from Commissioner Welch, second from Commissioner Long. Do we have any comments?
At this time, if there are any members of the public that wish to comment on agenda item number 24, please hit *9 on the telephone or raise your hand virtually in the Zoom meeting. And Madam Chair, there's nobody that wishes to comment on agenda item 24.
Okay, if there are no questions, all in favor, please raise your hand. Thank you. Item carries unanimously. Item 24. As far as you know, Barry, are doctors here yet?
I just got a note from Dr. Cho saying that all the doctors just are on the line now. Brian, can you promote Dr. Longley?
Yep. Give me one moment here, sir. We should have Dr. Longley. Do you want all of them promoted, sir?
Yes.
Okay.
Dr. Longley, Dr. Anand, Dr. Threadgill, and Dr. Finan. We already have Dr. Cho and Dr. Jameson.
Yes, sir. Give me one moment.
Let's do that now then.
Okay.
And doctors, once you get on, yeah, there you go. Just unmute yourself and turn on your video. You should be good to go.
Madam Chair, Commissioners of the Board, this is a local state of emergency. This would provide for an extension of our state of emergency from September 25th to October the 2nd. And you asked for an esteemed panel of medical experts from around our area to comment on their thoughts regarding this pandemic, where it's going and its impact. As we've seen, our numbers continue to stay steady and the mid 2s to 3% range. We still have case counts. We're also looking at the region. We believe the state of emergency and the preventative measures we've taken in the public education is working. I do understand the concerns about the mask ordinance, which has been the subject of a lot of public comment. However, we have this esteemed panel. I think, Madam Chair, we should let them, or maybe Dr. Cho can start and introduce the topic, and they can provide any thoughtful comments they have regarding the actions we're considering as we try to manage through this pandemic.
Yes, and thank you all for being here. I appreciate it. Dr. Cho?
Sure. Just in terms of updates on my end, and again, I appreciate all the doctors for joining us on the call and their willingness to sort of speak on the topics and their point of view as it pertains to their special areas, whether it's the hospitals, whether it's outpatient settings. As Barry mentioned, our numbers do look pretty good, relatively stable. Our 7-day case count is 80 cases per day. Our 7-day percent positivity is about 2.7%. It's obviously been going up and down. The hospital capacity is stable at this point as well. In terms of the schools, I know that gets asked every week. We've been 4 weeks since the schools now. The school board does keep tabs on the cases within the schools, and they divide it by staff and students. And as of yesterday, showed 38 staff members and 51 students. We did see a slight uptick in the percentage of cases that is comprised of the 0 to 19-year-olds, 13% year to date in September compared to 10 and 9% over the last few months. Overall, as Barry mentioned, our measures are working with social distancing and masks, which I would contend that is contributing to some of those positive numbers. So with that, and again, since the doctors are here, I'd like to turn it over to the physicians here. We have Dr. Larry Feynman from HCA, Dr. Nishant Anand from Baycare, Michael Longley from Advent Health, and Dr. Nichelle Threadgill from CHC of Pinellas.
Great. Thank you all. Dr. Feynman, what can you tell us?
Good afternoon, everyone. What I would tell you, and thank you for the opportunity, what I would tell you is that I believe that Pinellas County has done a great job. I believe that the mask ordinance has saved many lives. When I look at the numbers, as Dr. Cho said, the positivity is in single digits, which implies that we are adequately testing enough people to be certain that we have a representative sample. When I compare our new cases week over week to the state's new cases week over week, Pinellas County's rate is 77% higher in terms of increase as compared to the state in general. So we still do have an increase. When you look at the curves of new cases week over week, state versus the county, the state has flattened more than we have. So we are seeing an uptick. In fact, our new cases have gone up 2 out of the past 3 weeks. In terms of the mortality rate, Our mortality rate has remained stable, as has the state rate, but our mortality rate is about 66% higher than the state's rate. Our rate is 3.37, the state's is 1.90, which, I'll leave it to the others to perhaps comment on why I suspect we have a more vulnerable population perhaps than the general population in the state. We're also seeing now flu season come on us. And I think, that has to be taken into consideration. They're calling it the twindemic. We're seeing, as I said, a slight but definite rise in the number of coronavirus cases. And I'm sure the other physicians can speak about their facilities. One of our hospitals has already seen 2 patients actually hospitalized with influenza. So while the experience of the Southern Hemisphere seems to be a milder flu epidemic than we normally see, the scientific logic behind that is that masking has helped reduce the flu epidemic in the Southern Hemisphere. So looking forward, I think the fact that we're seeing a slight rise in our new cases, we're about 3 weeks now after the Labor Day holiday, which I think certainly was not a positive thing in terms of spread. And we're seeing schools starting and hearing about children becoming positive for COVID. I would strongly recommend that we continue the mask ordinance. The one thing that I would say is I certainly understand that people are getting tired of masking, and at some point you are going to continue to be pressed about should we stop it and when should we stop it. I don't know if I'm allowed to make a suggestion, but you can cut me off if I'm not. I would think that perhaps the physicians on the call can all, we do have a set series of calls that we make. Perhaps we can all get together and come to the county commission with a proposal of what metrics would be acceptable to everybody that we could start talking about rescinding the mask ordinance. But my final comment is you have saved literally hundreds of lives by this mask ordinance, and to stop it now, I think would be foolhardy. Thank you.
Thank you, Dr. Feynman. I think that's a great idea that you put together some metrics and bring them to us. We would really appreciate that, actually. Dr. Anand?
Thank you all too. I think Dr. Feynman said it really well, and Dr. Cho. Let me also thank you all for your leadership during this time. This has been quite a learning opportunity for all of us. And I wholeheartedly agree with Dr. Feynman that lives have been saved because of the efforts that have been put in place, both on the mask as well as multiple different fronts. I like to frame my comments on a couple of levels. I like to study the past so that we don't have the same challenges that we did before. I think we have to think of COVID a little bit differently than just the here and now, what's in front of us right now. If you look at historical context, our first little peak that we had happened roughly in late March, and we saw an increase roughly about 6 weeks later. Things got better as we headed into May. We saw an outbreak in the nursing home, so we did see a cluster. As we fast forward to June, tremendous outbreak. We saw our 18 and 35-year-olds that were incredibly infected at that point. Fast forward 6 weeks later, and that's when we started to see the increase in the hospitalizations, and then the death rate started to go up. So one thing I would always caution is it's very easy. I want to think about the here and now, but we have to think of COVID in six-week blocks. The second thing is we have learned a lot, and we're in better shape than we were before. I think our personal protective equipment, capabilities, how we manage COVID has really improved. Though there's only 2 major prevention efforts that we have in place until there's a vaccine available. One is mask, and the other is social distancing. What we've seen when masks were enacted and the mask ordinances were passed due to strong leadership, we saw that cases decreased. I mean, we had upwards of a significant increase in hospitalizations, and we've seen those numbers drop dramatically. Now, that was the past. As I go to the present, we're still not back to normal in the number of people with COVID that are in our hospitals. They've dropped dramatically, threefold from where they were at the peak, but they are still not back to normal. They're still higher than they were in early May. And so we're still seeing people coming in with COVID. and people are still unfortunately passing with COVID. My big concern is what Dr. Feynman said is whether you call it the twindemic or the tridemic or whichever one you want, it is virtually impossible to tell the difference between flu and COVID with the exception of a couple symptoms. And you add in all sorts of other respiratory illnesses like pneumonia. People tend to get pneumonia. There's the common cold, the other coronavirus that's less. And all of those added together are going to make it extremely hard for us to be able to differentiate the two. That means for people who are not wearing masks, if they've been exposed to someone with fever, cough symptoms, they potentially could get exposed to COVID. So I think another reason to really wear this, when you think about the implications for employers, for schools, for public businesses, for Dr. Cho's team to have to trace all these people that aren't wearing masks and have to try to track it down, that's going to incredibly overwhelm the healthcare system, and that's going to put us in dire straits. Now, Dr. Feynman mentioned that, and I've heard this before, that flu season was mild in the Southern Hemisphere, and I'll just lay out a hypothesis. This is just a hypothesis. But in the Southern Hemisphere, a lot of those countries were in lockdowns or stay-at-home orders, or they had some sort of social distancing mechanisms in place when flu season happened. We are not going to be in that situation. We're going to have people who are constantly moving around. And so I do believe that masks are a much better alternative to social distancing that's mandated. So I think as we think about the fall and we think about what we potentially could be up against, I always like to keep it simple and think of, what are the alternatives that we have? Well, we only have two treatments or two prevention mechanisms in place. One is mask. The other is social distancing. I would rather defer to the mask, and I do think they have proven successful. We've seen our rate of transmission of COVID go down incredible since those masks have been in place. So I agree with Dr. Feynman and Dr. Cho. I think that mask has been very effective for us. I think it has led to decreased transmission. That has led to decreased people being hospitalized, and that has led to decreased death. So as you all consider kind of the next thing, I just want to end where I started. Thank you for your leadership. We are in a much better position. So, starting back in March, we would have a lot of concern and angst. We are better at it, but we also know that our work's not done yet, and we still have more to do. And it really comes down for us in the medical community about every life that we can save is a well worth effort. And the most effective mechanism we have right now is those masks. So thank you.
Thank you. Dr. Longley.
Thank you so much for having me. And it's great to be here this afternoon with you all. Just want to, again, thank the county and Dr. Cho's leadership and Dr. Jameson with EMS. This has been a real heavy lift through these 7 months, and it's amazing to see not only where we've come, but how much more work we have to go, as Dr. Anand just said. But I'll keep my comments brief. I think what I'd like to share is that the science around using masks by the general public to impede the COVID-19 virus transmission is advancing rapidly. And right now, the preponderance of the evidence just indicates that the mask wearing reduces the transmissibility per contact by knocking down the transmission of these infected droplets. COVID-19 has been a challenge because there's so many things about it we just don't know. And unfortunately, some of those things are learned only over time and asking questions and watching what happens. What we do know is that there are many characteristics of the virus that point to transmissibility from human to human for several days before the symptoms are present. And that people who have the virus and that may not have symptoms or even know that they're infected are actually most infectious during those several days before they have their first symptom. And so the consequence then is that any successful intervention policy has to properly address the transmission due to infectious patients that don't even know that they have symptoms and may not realize that they're infected. And so I think the bottom line is that we've heard and we know that masks are saving lives. But wearing masks is really one of the most selfless acts that someone can take right now, because what we do know is that yes, it protects the person wearing the mask, but even more so protects the folks in public from you if you should have the infection. And so, we in the hospitals have a universal masking policy. We've seen diminishing infection rates in the hospital. We see different states, different areas of the country and the world that have done really well and knocked down that curve by implementing the masking. Is it the only thing? Absolutely not. I think it's a great physical barrier, along with hand washing, along with the social distancing. These things all together make a huge difference. But I think, the evidence is there. We're seeing it, and continuing to wear to wear the masks and avoiding a real debacle with the flu season around the corner, I think is of utmost importance, because it's already a challenge. Flu season's already a challenge in our area, as you all know, especially with the increased number of people that are in the area from outside of the county. But wow, that would be amazing to be able to keep better control by just pursuing this mandate. And I think that would be a great lift if we could continue to stick with that. So thank you for hearing me, and that's all I have.
Thank you so much. And last but not least, Dr. Threadgill.
Good afternoon. Thank you guys for having me, and certainly thank you for your leadership. I will agree with the doctors who have spoken previously. I think that masks are truly our primary tool to utilize in our defense against coronavirus at this time. Social distancing and using the mask. And so, one of the things that is, we look at, is it difficult to wear a mask, or is it difficult to stay home all the time? We know that stay at home order and things like that were really restrictive and really hard to do. And so as we begin to open up our communities and enjoy some of the activities and lifestyles and things that we like to do, how do we protect ourselves against this virus? I think is really important. And I think that masks are the key to do that. School started on August 24th. We had a significant number who chose to use virtual options. October is the next option for Pinellas County school students that may choose to return to school. And I certainly suspect that there will be quite a few who now will also return to those classrooms. And so we're looking at bringing more people into spaces. And so our ability to isolate diminishes a bit. So how do we protect ourselves, and how do we stay healthy? How do we protect ourselves as we bring more people into offices to work, into stores as we open more stores and businesses safely? And so masks are our tools to really do that. There has been some recent evidence that would suggest that not only do masks decrease transmission, but also may decrease severity of COVID-19 if you were to get it. And so, I think that it really just helps to prove that decreasing that viral load, decreasing the amount of virus that we spray and share is an important tool in our defense against coronavirus. So, in agreement with speakers that have spoken thus far on the panel, I think that masks are really important and really are a key to maintaining our level of safety in the communities that we serve.
Thank you. And I want to thank all of you for everything you've been doing during this time. It's been tough for all of you. And thank you so much for Dr. Threadgill, for all the testing that you all have done and how responsive you've been to the community. That's really great.
Absolutely. No, absolutely.
Questions for the doctors? Commissioner Welch.
Thank you, Madam Chair. And I'd like to thank all the doctors as well for the great job that y'all are doing. And please thank your doctors, nurses, and staff at each of your organizations for the work they do. Just wanted to quickly agree with the chair's assessment of Dr. Feynman's offer to put together some metrics for us. I think that's a great step forward. And also, not just formulas, but consideration of conditions on the ground, like the incoming flu season that you all talked about. The one question I had, and it's kind of a general question, but for your organizations, your staff, doctors, nurses, team members who've been on the front lines of this, just how are they holding up? Are things getting better? How do your organizations look in terms of your everyday staff that are out there doing the job for us?
I can answer and say that we have been incredibly busy with testing and really kind of managing in an outpatient perspective. And so we are not seeing, from my perspective, people who are severely ill. However, we are seeing those who are panicked and those who are afraid for any particular reason. And so I think that, overall, our team is doing a phenomenal job with what they're doing, but it is a stressful time. And so we feel very protected at work because we do have PPE and we do have the ability to distance and all the practices that we have for sanitizing and sterilizing. That happens at work, but then you go home and you're in your community, you're faced with your families, your neighbors, et cetera. And so really trying to maintain that can be stressful. But I think that overall, certainly our team from an outpatient perspective has done well.
Thank you, Dr. Threadgill. Any other doctors?
This is Dr. Nunn. First of all, thanks for asking, because we just have an incredible group of just nurses, physicians, other ancillary healthcare workers in the community across all the healthcare systems. And I remember the days when, back in March, it seems so long ago, but we had providers who were only worked in the outpatient world offered to come into the hospital to help out. Same thing with nurses. Everyone stepped in and chipped in where they could. I do think we have to keep this in mind. I do think we're at an inflection point. We're at a little bit of a reprieve where people are getting a chance to recover. And I think that's extremely important, is to allow people to recover. If we act appropriately and we have a mild flu season, mild COVID, I think we're going to be in good shape. You add one stressful time period, the last several months that we've been in, you add another couple stressful months to it. That's going to strain our workforce for sure. And that does not allow for enough recovery time. So that's my big concern. Our nurses and physicians are always willing to help out. And I've just been so proud of the team, always willing to chip in, and they've helped out. They picked up double shifts. They've done whatever they could. But I do think we have to be mindful of, as leaders in the community, that there is an opportunity for us to act so that they are safeguarded, their well-being is kept in mind as we go. So thank you for your question.
Thank you.
And if I may add, I think Dr. Nunn was absolutely correct. A couple of things have changed since we first spoke a number of months ago. Our physicians and nurses have become much more adept at treating patients with COVID. The armamentarium that's available to them is a little broader. We have medication now that we use. We have steroids that we didn't know worked. There was a tremendous fear of the disease at the beginning because we didn't know how it was transmitted. Going back to this conversation about masking, we didn't know what type of masks people should use. We didn't have adequate PPE. Everybody thought that every encounter, everybody needed an N95 mask. We know that's not the case, but at the time we didn't know it wasn't the case, and there was a lot of fear. Now I think we're at a steady state. We're not seeing a drop in numbers of patients, but like we said, it's stabilized for the moment, and people are starting to get their feet back under them. I think probably the most important thing that Dr. Anand said is we add another stress to them, though, it's going to be terrible. But right now, people are taking a deep breath. And if I could say, in terms of our employees becoming ill, and I have not spoken to Nishant about that, so I'd love to hear about Baycare or Advent. Our employees are not getting sick from the patients anymore. When they do fall ill, it's out in the community when they let their guard down. Yes, every once in a while somebody does slip up and become infected, but there's not that terrifying fear of the unknown anymore. They know what they need to do to protect themselves, and we're providing them with what they need, and they are protecting themselves.
Great.
Good to know.
Yeah, and I'll just say briefly, Miss, thank you for asking that question, because I think one of the most difficult things we've had to do from an administration is really managing the mental stress, the physical stress, and the fear and the unknown with our staff, which in many ways was just as crazy as dealing with the virus itself. To Dr. Feynman's question, yeah, we're seeing the same thing. We're not giving it to each other in the hospital. Our quarantine list has gone down, I think, to very few, a number of folks that are still at home. And so that's been really encouraging. And if you had asked that question 2 months ago, a one-word answer that would be they're tired. They were just exhausted, and but they're resilient. September has been a great month, really, in terms of sort of the reprieve, a breath of fresh air, a little bit easier to breathe, if you pardon the pun. But it is. We are seeing definitely a reprieve in the mental stress and the physical stress of what we dealt with for the last 6-7 months.
Well, please pass our thanks on to all of your teams. Thank you all for being here. And thank you, Madam Chair.
Thank you. Commissioner Long.
Yes, thank you very much, Madam Chair. I just wanted to ask very quickly if Dr. Feynman could reiterate the information about the polling that I had asked him to do a couple ago throughout the ADA system with doctors, board certified doctors that had a specialty in infectious disease, to find out if there were any of them who disagreed with the philosophy that wearing a mask was the first line of defense to protect against this horrible virus. Dr. Feynman, could you just share with us, please, what your findings were?
Yeah, actually, Commissioner Long called me and asked me if I could find an infectious disease physician who would be willing to perhaps present the other side or actually discuss the case against masking. And I sent the request to all 15 of our hospitals' chief medical officers, asked them to speak to every one of their infectious disease physicians. And honestly, to a person, not one of them was willing, not one of them believed that there was any reason to not mask. They were not willing to come on to your meeting and speak against masking.
Very much.
Thank you. Commissioner Peters.
Thank you, Madam Chair. A question I have is, each one of you said that we have 2 methods to prevent COVID. And I'm not disagreeing with that, but my question to you is, and I've asked Dr. Cho, and he's kind of alluded, but it's been very vague, so I'm gonna ask all of you. When some patients come in, I know they're treated with highly concentrated vitamin C. So wouldn't another really good defense for prevention be that we strengthen our immune system and we promote strengthening our immune system, whether it's vitamin C, vitamin D3, and zinc? I know that's what my doctor prescribes to every one of our patients, that every one of us take vitamin C and vitamin D to strengthen our immune system. Is that not also a prevention that we all could be promoting among the general population to strengthen our immune system? I mean, we're doing PR for exercising and eating well, but we've been touting the exercising and eating well for a very long time, and that hasn't really prevented a lot of disease in this country. So isn't there another method of prevention versus, I'm not saying instead of, including the 6 feet and including the mask, Don't you think maybe we should be promoting more of a stronger immune system versus just talking about eating well and exercising?
Well, I'll kind of go out on a limb here. First of all, I'm speaking for myself. I'm not an expert in autoimmunity, but I will say that one of the fatal complications of COVID-19 is not the virus itself or the pneumonia, but the body's own immune response to that. And in fact, earlier on, I mentioned steroids. The reason steroids help in severe cases is because it does kind of tamp down the body's own immune response. So boosting immunity is not necessarily a panacea for everything. We all should hope that we have good functioning immune systems. If we have vitamin deficiencies, we absolutely should replace those vitamins that are deficient. But if you had a way to supercharge your own immune system, you'd probably develop arthritis and gout and every other disease that is a hyperimmune response. So if you are vitamin C deficient, by all means, you should take it. Vitamin D as well. You should eat properly, you should exercise, and you will stay healthier than somebody who doesn't do those things. But I don't know that super doses of certain vitamins would in any way prevent you from getting this. And I would hope that you wouldn't want to, if you would supercharge your immune system, you might develop these complications that are the fatal ones of COVID-19.
Yeah, Commissioner Fields, this is Dr. Ahmad. So, I agree with my colleague, Dr. Flyman. I will never speak against trying to live a healthy lifestyle, which includes, like you said, diet, exercise, and if appropriate, supplements to help you make sure that you have, an appropriate healthy immune system. We've seen tens of thousands of people come through with COVID, and there's not a differentiator with people who are, taking supplements and seeing if there's a less likelihood for them to get infection. What we have seen in the literature, and on by my other colleagues in the medical, where we have seen confirmation in good research studies. We want good research data-driven studies to help us. And where we've seen the benefit is with the mask. We've seen that they've reduced it. If you're wearing a mask, then you're less likely to become infected or to spread it. If the other person is also wearing a mask, that percent goes down even further. And so I try to always just go back to what the medical literature shows us and where the studies have been done. And the good thing is there's a lot of studies that are out there that have been evolving over the last couple of months. And really those two things we keep talking about, and I think that's why you hear us fixated on that, is social distancing makes sense if you're not able to, if you're able to do that. If you're not, wearing a mask helps. The studies around the vitamin C, the zinc, melatonin in those studies, there's been a whole host of studies. We haven't seen anything significant, at least I have not seen anything significant make a difference for individuals. So I think we have to, it's possible that will happen in the future, but I think we have to stick to where we're seeing the evidence come right now. And that's those two areas that we talked about.
Thank you. And yes, Commissioner Eggers.
Yeah, just real briefly, I wanted to echo some of the other comments real quickly. Just say thank you to you all, to your doctors, nurses, staff, just incredible frontline folks. We've got them all over the county, and you all are no exception. So thank you for that. I really appreciate the additional comments focusing on nutrition, health, wellness. All that is super important that we're all doing it. If you haven't been doing it, do it. So, start doing it, because I think it all helps with some of the things that you just said. But one of the things, I can't remember which one of you mentioned about letting our defenses down, your own folks not getting it in the hospital, but then they go home and they kind of let their defenses down. And I've heard it specifically of a couple of cases where families have gotten together and didn't know that they had that. And one of them was asymptomatic, and then they get 3 or 4 folks in the family unit that got it. And actually only one of the maybe 12 or 13 of them actually has a severe case in both instances. So I think that's a point. I know you made it for your own folks going back out into the community, but I do think our residents, whether there's masks or no masks in place, that is something we just have to be careful and just make sure that we keep those defenses up. And just being careful, being smart, even when we get together with our families, because that's when I think we want to all let our hair down and kind of open up a little bit. But anyway, again, thank you for being here today. Thank you, Madam Chair.
Thank you. Anything else? Well, thank you so much for being here. We really appreciate it. We're gonna, okay, keep carrying on the good fight. Okay. If there are no further questions, I guess we're ready to take public comment. How many do we have, Brian?
At this time, if there are any members of the public that wish to comment on the local state of emergency or citizens to be heard, please hit *9 on the telephone or raise your hand virtually in the Zoom meeting. And Madam Chair, right now it looks like we have around 20 or so that wish to speak.
Okay.
Are we looking at 2-3 minutes?
We're looking at 2 minutes.
Okay. All right. So our first speaker is Mr. Dave Waddell. Mr. Waddell, if you go ahead and unmute, and you'll have 2 minutes to address the board.
Hey, folks, again. Well, the doctors that are remaining, and Commissioner Peters, I beat stage 4 cancer, and you're right about nutritional supplements. I was bringing in, they wanted me at 900 grams of protein a day, and I worked out a smoothie that had 1100. So it's kept me in good shape. But stage 4 cancer survivor, looking at cancer again, just had a blood test done the other day. What we have here is a real failure, and it's a liability issue. It's in our buildings. It's going to be in our buildings, just like mold. And the Board of County Commissioners has the jurisdiction and the oversight for air quality. I want to ask the doctors about recirculation of the virus in a form that is not a droplet, but is known as, oh, god darn it, now I'm having an old people syndrome moment, OPS. It becomes aerosolized. Thank you, Mr. Eger, or Commissioner Eggers. But we have a recirculation issue. My doctor right now is still at home. I just recently had a telemed with him. He almost died twice. He signed a document saying, don't ventilate me, because he knew that it was going to hurt him more than the ventilator would help him. My point being is, they believe that it was traced back to their ventilation system because they had an earlier occasion where 2 employees at the same clinic were infected. They went in and they did find mold, but there was no way to test to see if there was actually the recirculation of the virus.
Mr. Waddell, your time has expired, sir.
Dr. Cho and Dr. Jameson, can you address this for me, please?
Madam Chair, our next speaker is Aiden Barnes. Ms. Barnes, if you go ahead and unmute yourself and give us your first, last name, spelling, and address for the record, you'll have 2 minutes to address the board.
Hi there, my name is Aiden Barnes, address 10240 127th Avenue, Largo, and I'm calling on the board to end the state of emergency. I understand we give a lot of respect to doctors. They are, you know, there's no doubt. But what it all boils down to is personal freedoms versus forced masking for an entire year, because that's what we're looking at. I mean, I've heard the doctors speak. I understand that, you know, at first this was to stop the spread, but it's turned into a huge beast now, because it's no longer the numbers are good, we can end the mask. It's no longer, you know, the hospitals are not overwhelmed, we can end the mask. It's now indefinite masking into the future until a vaccine comes out for herd immunity. And that is highly concerning for me, because a lot of people are a little bit hesitant to take this vaccine right away until we can see what the effects of that are going to be. I've never seen something like this in my lifetime. This is not okay to force masks on people for a full year. Okay. For something that affects 80% of it is people 65 and up. Yes, please. We need to be protecting these people. Please stay at home, please. And the nursing homes, 70% of deaths are from the nursing homes. And I cannot stress enough how thankful I am that we are protecting our nursing homes, because these people are the most vulnerable. And we've done that. We've accomplished it. We continue to in our county. But we have to look at the facts. This is not affecting most people. This is affecting a very small segment of the population. According to the CDC, that 6% of deaths from COVID were from people who had on average 2.5 preconditions. So what precedent is this setting? Is this going to be from now into the future? Every time a bad virus comes out, that could affect people with multiple severe, preconditions, or the very elderly. Are we all going to have to mask up? I mean, this is scary to me.
Ms. Barnes, your time has expired, ma'am.
Thank you.
Thank you. Madam Chair, we have 20 remaining speakers that wish to be heard. Our next speaker is on the phone line, last 4 digits 4945. If you can go ahead and unmute and give us your first, last name, spelling, and address for the record, you'll have 2 minutes to address the board.
My name is David Happy. I'm at 850 East Lime Street in Tarpon Springs. First, a message for Commissioner Gerard because you don't answer emails. Last week, you admonished people for using their freedom of speech. And just let's be clear, people can say during this open time whatever is on their mind without conformity to what you think is politically correct. In light of the fact that your ordinance has harmed people in Pinellas County, I've talked to rape victims that are being openly accosted and harassed by businesses and individuals under the guise of your ordinance that people don't understand. In light of the fact that Pinellas businesses are not respecting exemptions contained within your face mask ordinance, and in light of the fact that you've expressed no interest in repealing the ordinance, by the way, Dr. Cho, you took a Hippocratic oath to do no harm, and your recommendations are doing direct harm to people of Pinellas County. Until such time as you're required to end the mask ordinance, because I'd like you to add a second emergency clarification that not only reiterates that businesses are required to honor exemptions listed in the ordinance, but penalizes individuals either employed by a business or private citizens for harassing or otherwise discriminating against people who are exercising their rights under the harmful mask ordinance that you people put in place. For the 8th week in a row, I'm demanding that you give a definition as to what you describe as temporary for this face mask ordinance. What specific metrics are you using to determine when to end the mandatory mask ordinance in Pinellas County? Now it appears that you want to hide behind the skirts of the very liberal mayor from Tampa and her equally liberal counterpart from St. Petersburg. This is getting disgusting. I'm requesting that Dr. Cho be recused from any further participation in determinations on when the ordinance should end, since he has a clear and direct conflict of interest. We've asked for him to simply disclose where the $56 million in funds went to the Pinellas County Health Department. We want an itemized list of where those expenditures were spent. And absent of him being willing to coordinate the release of that information specifically, we'd like you to find an expert to advise the Pinellas County Commission that does not have financial interest
Mr.
in
Happy, your time has expired, sir.
Thank you.
Madam Chair, our next speaker comes in on the phone line, last 4 digits 7868. If you can go ahead and unmute and give us your first, last name, spelling, and address for the record, you'll have 2 minutes to address the board.
Deborah Curran, Brisbane Street, Clearwater, Florida, 33763. I would like to see an end to the state of emergency and make masks a choice. I think that doctors are being silenced. We hear, only on the mainstream television and at this county committee meeting, doctors that are pro this. Many. There is doctors on Band.video, frontline doctors that came out saying that there is a cure for and a preventative, and that people should take zinc, vitamin C, vitamin D, and HCQ as a preventative or cure if found early when they find they have this. You've contributed to the fear where none is necessary. There's no bodies laying down, dropping dead all over the county. This is a feeding frenzy of fear. And we see those that are affected, the elderly and the ill, and people that would die from a bad cold, pneumonia, or the flu, or even a flu shot. So no emergency should remove our personal rights. We have lost too many, from attending church to going to work with the threat of being traced or fined for not wearing a mask. And there's a state statute against masking. Statute in Florida State Statute number 678, I believe it is. And there's no reason to take anyone's personal liberties or rights away at this time, because there is not much of an emergency anymore. And right now, they're claiming there's only 9,000 deaths throughout the United States from this, you're calling it a disease. It's a bad cold, in my opinion. And that's my opinion. I'm not a doctor. But then again, these doctors are all being politically correct. You have the left,
Ma'am, your
right,
time
and
has
the middle.
expired, ma'am.
Thank you.
Thank you. Madam Chair, our next speaker is Yvette Gaw. Yvette, if you go ahead and unmute yourself and give us your spelling and address for the record, you'll have 2 minutes to address the board.
Hi, Yvette Gaw, 9371 Blind Pass Road. We have gone from a pandemic to a case-demic. And I respectfully disagree with your doctors who are trained in their specific modality, which is fabulous. As you mentioned, I didn't hear them talk about supplementation. I've been working in our naturopaths, and I'm a health advocate and health enthusiast myself. But Dr. Carrie Mullis, and I would encourage Dr. Cho and Dr. Jameson to look up Dr. Carrie Mullis, the inventor of the PCR test, which is on record stating that this test cannot be used to diagnose active infections, only establish the presence of genetic code. Even if it could detect active infection, there is no standardized amplification cycles. Currently, the average cycle that is used is 30 to 40 times. That means they take the virus, they amplify it 30 to 40 times to find the virus. That being said, at your best, results are inconsistent and should not be used on a basis for determining public policy. This test is not a good indicator. It's a big copy machine. Statistically, people are not dying. There are active therapeutics that are available. And here's the thing, the doctors that came on, of course, no one's going to stand out. I personally know doctors from all over the country, and I have been personally told by others who have family members they will not speak out because they will be disciplined. They will have the board called on them. Look at Dr. Scott Jensen in Minnesota and what happened to him getting a letter just telling the truth and having him how to write out a death certificate. So he got lambasted. So you have to, having doctors that agree with your narrative and that don't talk about supplementation and what Kathleen Peters brought up. Are you kidding me? So I just don't understand. So respectfully, Dr. Cho and Jameson, y'all need to look into that and stop dictating and saying a mask is going to help me. Let me take personal responsibility for myself and stop telling me that I have to wear a mask to protect myself and someone else when that mask actually is doing harm.
Ma'am, your time
Check
has
out
expired.
Dr. Russell Blaylock, MD.
Madam Chair, our next speaker is Rebecca Rausch. Ms. Rausch, if you go ahead and unmute yourself and give us your spelling and address for the record, you'll have 2 minutes to address the board. And Rebecca, you'll have to unmute on your side, please. Bottom left corner.
Hi, my name is Rebecca Rausch. Can you hear me?
Yes, ma'am.
Roush. My address is 1732 Bradshaw Lane North, St. Petersburg, Florida. This is my first time ever calling in and listening to a commissioner meeting, and I have to say I'm fairly appalled by what I've heard. While you had a racially diverse medical board, there was no actual scientific discussion. One just patted the other on the back, and then you guys patted each other for doing a good job. But our immune systems and our economy.
Ms. Rausch, we can't.
I'm a nail technician. I've worked for 10 years through other types of flu seasons and illnesses. I've never once gotten sick, not because I wear masks and gloves and all of the things that stay 6 feet from my client, which is impossible, but because I know how to manage my own immune system. I know not to touch my face. I know to wash hands. These are basic things. So meanwhile, instead of being a Floridian, which in my opinion, Floridians are people who settled a swampland. They've done an impossible and went against the odds. And instead of standing on our heritage, we're literally just giving it away. I don't understand why we're not standing up for freedom and personal choice and personal responsibility. All of the doctors on the panel cited very vaguely evidence, but never once gave a study or a randomized clinical trial. But if I say that a strong immune system or high levels of vitamin D will in fact increase immune system, you're going to ask me for a randomized clinical trial, which I could produce for you. I'd like to hear more scientific, rigorous discussion, and not just a bunch of people who agree with themselves. That, in my opinion, is a religion, not science. Science is evolving and changing, and we need to change with it. It's time to undo the mask mandate. We thought it was a good thing at the beginning. We know now it's not. If we look into the studies that do exist, we know they are not effective at preventing the transmission transmission of any type of virus. So I would
Ms.
just
Raj, your time has expired, ma'am.
be a true representative, a true Floridian.
Madam Chair, our next speaker is Virginia. I don't have a last name. So Virginia, if you go ahead and unmute yourself and give us your first, last name, spelling, and address, you'll have 2 minutes to address the board.
Okay, thanks. My name is Virginia Frizzle, Frizzle. I'm on Crown Drive in Largo, Florida, 33774.
Thank you.
All right, let's start with Rule 3428, Declaration of Emergency. Upon finding that the threat no longer exists, the board or its quorum are unable to meet, you can terminate the state of emergency. What is the threat? You know there's not a threat. Let's go to the government on quarantine. The quarantine law basically says that this subsection does not even apply to influenza. So you're not following quarantine constitutional law, which yes, it's under the severe acute respiratory system, but the numbers aren't there according to constitutional law. And it also says it does not apply to influenza. One doctor says no meds. One doctor says there is meds. I know for sure the FDA has approved hydrochloroquine in the hospital to be used in the hospital. I know for sure that it is on the CDA website that hydrochloroquine is allowed to be used in the hospital in emergency, as well as the other treatments are available. So we have one doctor absolutely not telling us the truth. Again, somebody said panicked and not severely ill. Correct. What are you doing? You are creating fear and panic. Correct. Yes. Dr. Cho, oath to do no harm. You're causing lots of harm with your fear chanting. Rah, rah, rah to the mask, making our children sick, putting acne on our faces. I've heard several people getting bacterial effects. Several. I want you to talk about the bacterial effects that this is causing with masks on, Dr. Cho. I want you to explain this. And how is this a better effect? I'd rather take D3 to get rid of a virus than I would have to.
Ms. Frizzle, your time has expired, ma'am.
No, no, no.
Thank you.
Madam Chair, our next speaker is David Katsaros. David, if you go ahead and unmute yourself and give us your first, last name, spelling, and address, you'll have 2 minutes to address the board.
Thank you, David Katsaros, DavidKatsaros. I'm in Palm Harbor, Florida.
Thank you.
I would respectfully request the board to end the current SOE, and I would also request details on how and where those state of emergency funds were allocated by the county administrator since inception. Secondly, I'd like to be allowed to manage my health without government intervention. I'm not responsible for others. I'm responsible for me and my family. Each week, we ask, what metrics or percentages will you be satisfied to end the SOE and mask mandate? Each week, nothing. I think a strong mask recommendation would be a better case. Odd that not one doctor had a differing view today. Not one. Handpicked by Dr. Cho or the commissioners, this is politics at its best. One view, same message, and the new world order. Not one doctor mentioned treatment or what medicine is having a positive effect. This is fear-mongering in its simplest form. This virus has a 90%, a high 90% recovery rate. This is just amazing that you've compiled these folks to breed fear and mental stress. Everyone thinks because you're a doctor, you're suddenly smarter than everybody else, like you're some sort of supercomputer mind. Remember, it's called practice. Often they are right, and often they are mistaken. Let's hear from an autoimmunity doctor. Best practices to supercharge immune systems, washing hands, getting outside, exercising, eating healthy, vitamins. What about convalescent plasma? Not one doctor talked about it. Not one doctor talked about and the positive effect that it has on those in the hospital. And then Dr. Feynman, he quote, new cases week over week is 77% higher in terms of an increase. And mortality is 60% higher. What or where are you getting your data from? Why didn't you share this? Dr. Nishant said we are not back to normal in folks in hospitals. Well, what is normal? He didn't share that. And Dr. Longley said symptomatics.
Mr. Katsaros, I'm sorry, your time has expired, sir.
Prior to symptoms, what documentation?
Thank you.
Madam Chair, our next speaker is Carla Rudolph. Ms. Rudolph, if you go ahead and unmute yourself and give us your spelling and address for the record, you'll have 2 minutes to address the board.
Yes, this is Carla Rudolph. I live in St. Petersburg, and I'm calling to request that you end the state of emergency and mandate and of course, the masks. I just listened to all these doctors. I didn't really hear any facts. I heard lots of opinions from them. They said, "Oh, we've saved a lot of lives." Well, where are the facts to go with that? It was a subjective opinion, and the hypothesis, it was a hypothesis by one of the doctors about the Southern Hemisphere not having a bad flu season. It's a hypothesis. And I kept hearing them say, I think. Where are the facts to back this up? They don't have them because I don't think they really exist. The curve has been flattened. People are not dying. And they even said that's really hard to tell the difference between the COVID and the flu. So what are you going to do? Are you going to start requiring masks for the flu too? The real question is, what is this state of emergency? There is no emergency. It's you haven't defined it. And even in the executive order, it says you're supposed to tell us what it is. And then you're supposed to disseminate that information to the general public. I haven't heard how do you define your state of emergency? When does it end? I was talking to a homeless guy the other day, and you would think in the homeless community where they're not really wearing masks, their hygiene facilities are not available, you'd think the homeless community would be decimated by this. He didn't know anybody who got sick or died. This is all a lot of baloney. You guys really need to pay attention to the facts. And I know that Yvette said that, or one of the callers had said that the real doctors are they're afraid to come out because their practices, they're threatened, their livelihoods. They've got families to feed too. So it's just, you guys are continuing with this fear, and that is the fear that people have, and it's because of the lies. You need to stop this. Listen to the facts.
Ms. Rudolph, your time has expired, ma'am.
Thank you.
Thank you.
Madam Chair, for the record, we have 17 remaining speakers. Our next speaker is Dr. Elena Levine. Dr. Levine, if you go ahead and unmute yourself, you'll have 2 minutes to address the board.
Thank you. It's Dr. Elena Levine. I live in Dunedin at 34698.
Thank you.
I first want to agree with all of the medical professionals who spoke today. You know, I'm also board certified in public health and preventive medicine, and they were great. I thank the commission for inviting and listening to them, for their informative, calm, scientific data that was presented that I heard. And I also want to draw one point from that the schools that I heard today, that the schools may have more attendance in October. And I was just hearing an epidemiology report this morning about the high transmission rates among young students, young kids. And I think we're going to see a lag. We always see a lag between the cases, the hospitalizations, the deaths. So we need to keep in mind that we don't know yet what's going to happen when kids bring this home from school back to their communities. They often are having less symptoms. And I also want to bring up that we need to question how many cases there are. Many people are not getting tested, especially asymptomatic people who can transmit this. We also need to remember it's not just the deaths that are tragic here. There is tremendous multi-organ system involvement in people who are going to suffer the rest of their lives, terrible disabilities, economic hardship, and that this virus also attacks more disproportionately the poor and people of color. And we really all need to keep all of this in mind every week, and we must continue this. The doctors were all excellent, and I so appreciate the calmness and the good questions that the commissioners asked of them. So thank you all so much. I'm so sorry you have to be subjected to some of the hostility that's coming in. So thank you again.
Thank you.
Madam Chair, we have 15 remaining speakers that wish to be heard. Our next speaker is Karen Mullins. Ms. Mullins, if you go ahead and unmute yourself and give us your spelling and address for the record, you'll have 2 minutes to address the board.
Good afternoon, commissioners. Thanks for taking our calls, our information. I just want to say, Dr. Fauci yesterday stated the public health measure should be a gateway to opening the country as opposed to the obstacle to opening the country. What evolved is people took sides. Wearing a mask or not is not a political statement. And that's really very unfortunate because this is purely public health issue. It should not be one against the other. And unfortunately, you're hearing some pseudoscience. I would be regress to say that I am so for face masks. It's the minimum that we can require, the minimum that we can do for not only the person standing across from us or standing next to us in line at the supermarket, but being without a mask could affect the next person that person meets. So we're not talking about ourselves here. We're talking about the populace as a whole. Thank you for your time. Thank you for listening to the doctors. And I wish you good luck, and I will talk to you next week.
Thank you.
Madam Chair, our next speaker is Rob Hellinger. Mr. Hellinger, if you go ahead and unmute yourself and give us your spelling and address for the record, you'll have 2 minutes to address the board.
My name is Robert Hellinger, spelled exactly how it sounds, and I'm a 32-year citizen of Pinellas County that lives and owns a business in Largo. I'm also a proud member of Pinellas Watch, a group created for citizen oversight of the Commission. It's time to allow the state of emergency to expire. If it expires, the mask mandate will expire with it. You can then immediately implement a new state of emergency without the ordinance. This allows you to still collect your federal funds. Those that are uncomfortable, like the ones that we've just heard from, are going to wear one anyway, regardless of if the mandate is in place. The rest just wants freedom to choose and not be discriminated against. I also believe the expiration of the mask mandate will help heal the divide that was unjustly placed on the community by the Commission. Because of your unconstitutional mandate, people with legitimate health reasons for not wearing a mask are being discriminated against for simply exercising their rights. This needs to stop. The solution is easy, yet you want to listen to your so-called medical experts, crackpot mayors, and the Sierra Club, all of which are bought and paid for. This is shameful. The citizens that you are supposed to be representing are taking notice of your incompetence and failure. Rest assured that we will do what is best for our county, and there is no amount of censorship that will stop us. We are here to stay. I want to reiterate that it is not inappropriate for us to speak. It is a right that is afforded to us by the Constitution, yet you blatantly censor us week after week. Just who in the hell do you think you are? Your obsession with trying to censor those that disagree with this unconstitutional mandate means that you are happy with ignoring your constituents and the Constitution. This sets a dangerous precedent, and it will not stand. Do the right thing. Let this state of emergency expire. It's what your constituents want, and it's the right thing for Pinellas and the Tampa Bay area. Thank you.
Thank you.
Madam Chair, next speaker comes in on the phone line, last 4 digits 1330. If you can go ahead and unmute and give us your first name, last name, spelling, and address for the record, you'll have 2 minutes to address the board.
Hi, my name is David Ballard Geddes Jr. I live on Georgia Avenue in Palm Harbor. Personally, I feel I owe a well round of applause to my carpetbagging government for having thoroughly thought out the perfect scapegoat, using the coronavirus as predisposition to the staging of a future cholera outbreak, using our sprinkler systems and getting us all to inhale our own fecal matter. Your doctors are filibustering for you. I call to question the biological, the chemical, the noxious use of reclaimed water, as reclaimed water is claimed as noxious in fact in statute 70.001, statute 163.3167, section 11 in 2007 claims it to be used as a clearinghouse mechanism, followed by Executive Order 13406, which clearly states to acquire abandoned property, to quiet title to abandoned property, as statute 15303, section 5, in support of aiding the reclaimed water occupation abeds the eminent domaining of civilian-owned property, manifested as due process to the 14th Amendment. The coronavirus is a predispositioned false narrative when, in actuality, the reclaimed water is intended to give us Ebola through the breathing of our own feces. Reclaimed water is George Bush's sleeper cell, having 3 fingers of contempt pointing back at his pride. Thank you.
Thank you.
Madam Chair, our next speaker is Anita Holyfield. Anita, welcome back. If you can give us your spelling and address for the record, you'll have 2 minutes to address the board.
Good afternoon, commissioners. The reason I wanted to call in has nothing to do with the state of emergency, and I would ask that, if you can, like, separate people who really don't want to talk about that and everything else. The reason I'm calling is to ask the commissioners to consider inviting all the other duly elected constitutional officers, the clerk, the tax collector, and the property appraiser, at least once a month to one of your meetings. I had an unfortunate opportunity to interface with an elected, the property appraiser. I asked the question that was not answered, and so I'm going to ask publicly. I'm looking for a public information request to find out if Pinellas County was included in a recent study regarding property appraisers, where property owned in minority counties in the minority communities are paying a higher property tax based upon how the information is processed. The current property appraiser did not provide me with that information, so I'm publicly asking the county commissioners to research that information for me. Thank you.
Thank you.
Madam Chair, our next speaker is on the phone line, last 4 digits 5195. If you can go ahead and unmute yourself and give us your first, last name, spelling, and address for the record, you'll have 2 minutes to address the board.
Yes, can you hear me?
Yes, ma'am.
Yes. Okay, thank you so much. I am calling in about the current state of emergency. I don't think I could add any more to the people that have gone before me.
Ma'am, can we have your name and address for the record, please?
Sorry, yes, my name is Dawn Lechner and my address is Clearwater, Florida. Sorry about that, thank you. So like I said, I don't think I could add any more to what they've already said, and I'm trying to control my emotions, but there is no current state of emergency. Your doctors said it themselves. There may be cases and there may be rises and falls in cases, but nobody's dying on the street. And therefore there is no emergency anymore. What there is fear. And it's consistent. The doctors propagate the fear, you propagate the fear, and all of it allows you to trample all over our freedoms. And anything that goes on my body is my decision to put on my body, not your decision to put on my body. And are we going for like 0% illnesses? Are we shooting for that? Because that's never going to happen. And so another caller had said that this is not political, it's public health. It is political, and it became political when you forced it on us. So I have no problem helping my neighbor. I have no problem helping care for them. It's my joy to do that. But for you to force mask wearing on me and have no basis for it at all, I accepted it the first 2 weeks you did it. I understood. This I do not understand, and apparently a lot of others don't understand either. And it would be really helpful to have doctors from other medical perspectives on, not just AMA or board certified doctors. There are other doctors that are well qualified to speak on things like this as well. So although I appreciate the doctors that were on today and much respect for you, there is other options that need to be seen through, and we are still waiting on a metric which you have promised and not delivered. So I just thank you very much. You'll have a good day.
Thank you.
Madam Chair, our next speaker is Isaiah Neal. Isaiah, if you can go ahead and unmute yourself and give us your spelling and address for the record, you'll have 2 minutes to address the board.
Thank you. Isaiah Neal, N-I-E-L. I live in Largo.
Thank you.
I wanted to wish everyone a happy 6-month anniversary of our national 2 weeks to slow the spread, flatten the curve, and alleviate our health care systems. As a Pinellas County resident and father of 4, I'm calling for an end to the local state of emergency. We don't currently have a pandemic crisis. Sure, there's cases, but it's not a crisis. It's certainly not an emergency. And the only reason we would face a twin-demic, as alluded to by the doctors who called in earlier, is if this commission supports a public marketing campaign to push flu shots. This makes no logical sense if it's really about health and safety. All along, you've supported the measures to keep the spread of COVID, just to turn around and encourage citizens to roll up their sleeves and inject a live virus. directly into our bodies. If you don't vet the medical studies that are out there showing the correlation between those who receive flu shots and those who contract COVID, then you're complicit to any rise of positive cases. And we know the state of Florida and the county of Pinellas are extending the state of emergency for only one reason, which is financial incentive and reimbursement of public funds. It's time to put people over profits and end the state of emergency immediately. And then my last question, and it's not rhetorical, I'm hoping there's a response, is you've built in exceptions to the ordinance. What do we do? What's the avenue to report businesses who aren't allowing for the exceptions, who are 100% strictly not allowing for any of those health exceptions for children or for those with medical conditions?
Thank you.
Madam Chair, our next speaker comes in on the phone line. Last four digits 0415. If you can go ahead and unmute yourself and give us your spelling and address for the record. I'm sorry, name, spelling, and address for the record. You'll have 2 minutes to address the board. And 0415, you'll have to unmute.
Can you hear me?
Yes, sir.
Okay, my name is James Lechner, Lechner, and I live in Clearwater, Florida.
Thank you.
And I'd like to start off saying that I'd like to end the state of emergency. It's the fastest way to end this mask mandate, and I think it would be best beneficial that all masks could be a choice voluntarily. And I've heard the medical issues and I've heard the political issues. I want to come at it at a different angle. Our family has been praying for each one of the commissioners, and we appreciate what they do. But their decision making has to be under the authority of God and God alone. So I'm going to give what God says in his words as far as decision makings. 1 Timothy chapter 2 says, I urge then, first of all, that petitions, prayers, and intercessions and thanksgivings be made for all people, for kings and all those in authority, that we may live peaceful and quiet lives in all godliness and holiness. Psalm 2 says, therefore, you kings, be wise. Be warned, you rulers of the earth. Serve the Lord with fear and celebrate his rule with trembling. It is your authority under God that you make decisions. Romans says, so then each of us will give an account of ourselves to God. You will give an account for every decision you make. Matthew 12 says, I tell you, on the day of judgment, people will give an account for every careless word they speak. For by your words you will be justified, by your words you will be condemned. Jeremiah says, the heart is deceitful above all things and desperately wicked. Who can know it? I, the Lord, search the heart and test the mind, to give every man according to his ways, according to the fruit of their deeds. And I want to end with Ecclesiastes chapter 12. At the end of the matter, of all matter, all has been heard. Fear God and keep his commandments, for this is the whole duty of man. For
Sir,
God will bring every deed into judgment. Thank you.
Thank you. Madam Chair, our next speaker, we have, for the record, Madam Chair, we have 9 speakers remaining. Our next speaker is Moon Riley. Ms. Riley, if you can go ahead and unmute yourself and give us your spelling and address for the record, you'll have 2 minutes to address the board.
Okay, can you hear me?
Yes, ma'am.
Okay, my name is Moon Riley. That's R-E-I-L-L-Y, and I live in Pinellas Park, Florida.
Thank you.
And the comments I wanted to make today were, again, because we don't test those who aren't having symptoms, we don't know who is or isn't carrying or actively spreading the virus. The support costs are astronomical for those who are infected, both financially and emotionally, and in terms of protective devices and medical support staff. It's huge. It is a crisis. And the other thing that I was thinking of would be really nice to know more about the results of contact tracing, not the names, but the numbers. For how many patients has there been successful contact tracing? And how many people who are infected have been found using it? That would be tremendously useful to us. We are so in the dark about who has this disease and who doesn't. The other thing I wanted to say was, for those who can't wear a mask, would a face shield work? Are there some way to keep them safe as well. And that's what I had to say. Thank you for all your work.
Thank you.
Thank you.
Madam Chair, our next speaker is Gail Donowitz. Gail, if you can go ahead and unmute yourself and give us your spelling and address for the record, you'll have 2 minutes to address the board. And Gail, you'll have to unmute on your side, lower left-hand corner of Zoom.
Thank you. Can you hear me now?
Yes, ma'am.
You can?
Yes.
Great. Okay, so I'm Gail Donowitz. I'm in Dunedin, Florida, and I'm calling because I actually want to maintain the state of emergency until the COVID hits, and I have a few points here. Firstly, I want to thank you all for what it is that you're doing. Secondly, we've got certain things that we know that are increasing our vulnerability. Schools are open, and they're going to get open even further. The flu season is beginning, and we've only just begun having flu and COVID. Bars are reopening, although 50% capacity is questionable in terms of being monitored, and snowbirds will be returning. So what we don't seem to be discussing is how to increase vigilance and protection, how to encourage interventions, how to look at the data that you're actually speaking of creating before any decisions are made to do anything differently. I think that the vigilance that we are beginning to actually see is encouraging. The bars opening is actually very concerning. And the work that you're doing, I'm really sorry that people are not understanding that we're responsible for everyone, that people are dying across this country. And this country is actually not just about what works on our block or in our bedroom. So I think that people actually need to be responsible, maintaining the state of emergency until the COVID risk is under control. And I'm grateful to the commission.
Thank you.
Madam Chair, we have 6 remaining speakers that wish to be heard. Our next speaker is Dawn Bowler. Ms. Bowler, if you'll go ahead and unmute and give us your spelling and address for the record, you'll have 2 minutes to address the board.
Yes, good afternoon, Dawn Bowler. Boy.
Dawn, your internet connection is really suffering right now.
I live in St. Peter. I know I said I wouldn't call again, but this.
Madam Chair, it appears we
Can
lost.
you hear me now? Can you hear me now?
I can hear you better now. Yes, ma'am.
Oh, I'm sorry. That was really weird. Okay. Is it clear?
It's a little bit better. Yes.
Okay. I'm sorry. I said I know I said I wouldn't call again, but this has been eating me up, and I'm sure I'm going to get heat for this. But I have personally learned the hard way that hate and anger feed hate and anger, and no matter the foundation of whatever stand you have, if it's based on hate and anger, it's wrong. Psalm 37:8 says, "Don't give in to worry or anger; it only leads to trouble." Proverbs 29:22, "People with quick tempers cause a lot of quarreling and trouble." Ephesians 4:26, "If you become angry, do not let your anger lead you into sin, and do not stay angry all day." We sit and watch as cities burn throughout our country, the hate for one another destroying the very foundation of our country, and social media has become the poison of society. We don't have to agree with people, our elected officials, but we also don't have to hold animosity and viciousness in our hearts. There is a right and wrong way of handling disagreements, but to allow a situation to change character, to change who we are, makes us no better than that which we stand against. We have lost respect for one another. We have lost ourselves in this mess of a pandemic and political party war that is happening all over our country, regardless of which side you stand. Mask or no mask, Democrat or Republican, there is little respect from either side, constantly going in each other's throats. There are laws against hostile workplaces, but we have together created a hostile environment with our own community, our home. Yes, there is collateral damage from the response of COVID, but if we allow the hate and hostility to consume us, we've only destroyed ourselves more than anything COVID or the response could ever accomplish because we've allowed hate to rule. There used to be a day we could agree to disagree, and now we are a community that is about to erupt. If we are ever to fix whatever we are in the middle of, it will require a searching and correcting of our own hearts, a personal change. Psalm 139:23-24, "Search me, O God, and know my heart. Try me and know my thoughts, and see if there be any grievous way in me, and lead me in the way of everlasting." One other request, Sheriff, would you please touch base on inappropriate conduct that we are experiencing out here? And at what point does it pass the criminal line?
Thank you.
Madam Chair, we have 5 remaining speakers. Our next speaker comes in on a Galaxy S10e. If you can go ahead and unmute yourself and give us your first, last name, spelling, and address, you'll have 2 minutes to address the board.
Hi, my name is Kathleen Gozo. I'm in Tarpon Springs, Florida.
Thank you.
Calling again to ask that you extend the mask mandate. Kathleen Peters, wake up, honey. Saw you sleeping earlier, giggling on the phone. If this is too much for you, you can give up your seat. Your circus has been calling in. So I hear the crazy, I hear the Bible, I hear the other crap. Thank you, Dr. Cho, for being a voice of reason. It's great that we're low. It is that everything is going down. I just don't think we should wait till we're dying in the streets to take a minor thing like wearing a mask. And I think if people on this commission can't take this seriously, they literally should step down. I watched Kathleen Peters for 15 minutes talk and giggle while people were speaking. That is so disrespectful. I can't even tell you. I mean, it's just disgusting. And do something about that. So, no, I'm not afraid to go out. I just listen to science. I think the simple thing is to continue a mask, to keep Pinellas strong, keep Pinellas safe. And you know what? When you live in a community, you enter into an unwritten contract to interact with people. So these people that are saying, oh, it's just about me. No, it's not just about you. It's about us. Thank you very much. Thank you. Sorry I got so loud, but to watch one of our members who makes like $100,000 a year sit there and laugh while we call in pissed me off. Good day to the rest of you. And again, I apologize for yelling.
Thank you.
Madam Chair, we have 4 remaining speakers. Our next speaker is Susan Mack. Ms. Mack, if you go ahead and unmute yourself and give us your spelling and address for the record, you'll have 2 minutes to address the board.
Hi, this is Susan Mack from North Reddington Beach.
Thank you.
While we know you've already made up your minds, I would still like to respectfully request the Board of County Commissioners let the current state of emergency expire, allowing the mask ordinance to expire with it. I would also like to ask the commissioners, when are one of you going to stand up for us and put the people who elected you before the politics and the dollar signs? Every week, week after week. We all know the likelihood of this virus is 100. I mean, it's not going to be eradicated. It's not. We know the survival rate's 99%. The data no longer supports the measures put in place. We all look at the same dashboard. Numbers are numbers. You can spend them however you want. But again, nearly 100% survival rate. Do you go out anywhere? Everywhere you look, people are not wearing masks correctly. It's comical, actually. This whole thing has turned very ugly, and to be honest, has pitted this county against each other. Red versus blue, neighbor against neighbor, shop owner versus consumer, constituents versus this board, and after today, patient against medical provider. We as a community have reached an impasse. Common sense needs to come into play. People need to be accountable for their own health. It's not the job of this board to parent the community. You need to allow people to make choices for themselves and let those know needing your parenting, it's okay to choose. Aren't you tired of not breathing fresh air? And please do not come at me with it beats a ventilator or death. That rhetoric is old, and ventilators and death happen in very extreme cases. Excuse me. You literally brought executives from hospitals looking for funding for their establishments to speak to us like school children today. Way to cherry pick those who will say exactly what you wanted them to say. How much did you pay them? Have they conducted clinical trials on the effectiveness of masks? I can tell you they haven't. This is their opinion, and none of them are my doctor and should not be dispensing advice based on opinion.
Ms. Mack, your time has expired, ma'am.
Thank you.
Thanks.
Madam Chair, our next speaker is Sherry Fiorenzo. Ms. Fiorenzo, if you can go ahead and unmute yourself and give us your spelling and address for the record, you'll have 2 minutes to address the board.
Hi, Sherry Fiorenzo, Fiorenzo, Largo, Florida.
Thank you.
Last week, we traveled to Fort Myers for a specialist doctor appointment. While we were there, we stopped at 2 gas stations, 2 restaurants, and 4 stores. The only place I had to wear a mask was at my doctor appointment. There was a mixture of people everywhere wearing and not wearing masks. Nobody was being nasty to anyone. No dirty looks, no fighting, no public shaming. People were out taking care of business, minding their own business. Other places with no mandate and a large population seem to be doing fine, and here we are with the nanny state social experiment. Just what is the justification for the Pinellas County mask order? In terms of hospitalizations, deaths, current cases, and how much positivity is in our community, it's low and it's been low. It does not warrant this mask mandate. If you can't figure out what it takes to end it based on us by specific criteria and are only listening to doctors who will never say it's okay because they would be reprimanded, then you're not doing your job for us citizens. Please end the mandate.
Madam Chair, our next speaker is Barbara Walker. Ms. Walker, if you go ahead and unmute yourself and give us your spelling and address for the record, you'll have 2 minutes to address the board.
Hello, this is Barbara Walker, 3019 Bradford Circle, Palm Harbor, Florida. And I have been a resident of Pinellas County for 50 years this year. I just wanted to thank you all, the commissioners, for staying the course, and thank all the doctors for giving their time today and really putting forth a very good information. I really appreciate it. And also, I wanted to say thank you to Brian for doing a really good job with the calls. So that was it, and I hope y'all have a really, really good week.
Thank you, Ms. Walker. Madam Chair, we have 3 remaining speakers. Our next speaker is, I don't have a name, it says Zoom user. If you can go ahead and unmute yourself and give us your first, last name, spelling, and address for the record, you'll have 2 minutes to address the board.
Good afternoon. My name is Jessica Gilley. I live in unincorporated Pinellas.
Thank you.
That's Gilley. As you may know, I'm a co-founder of Pinellas Watch. One of the things that we're trying to do is get a dialogue with the commission. We send emails every week, and then in return, we get belittled. We get anecdotal stories about people's grandchildren. We get cherry-picked experts. Really, we ask questions week after week. We ask, what's the end state? Is it 0%? Is it 20%? Can any one of you tell me right now what percentage we were at when we started this mandate? You're elected officials. You're citizen servant leaders. We need you to listen to us. We need answers from you. Every week we get leading questions from the doctor of the day, from various commissioners on the board. Why don't we start having dialogue? Why don't you start answering our questions? Has the county attorney advised you not to answer us? Tell us the truth. That's all I have.
Thank you.
Madam Chair, we have 2 remaining speakers that wish to be heard. Our next speaker comes in on the phone line, last 4 digits 2157. If you'll go ahead and unmute yourself and give us your first, last name, spelling, and address, you'll have 2 minutes to address the board.
Well, you're not going to like I called again, but I'll give my other name, Virginia Dassler, Dassler. And I just want to say thank you, Peters, for being a voice on that board. She's the only one that actually ever asks the right questions and talks to us. Miss Gerard, who never emails me back how many emails I've sent. So I just want to call back and say, good for you, Kathleen Peters, because you know what? You're staying on that board, Miss Gerard. I hope soon you're off. And Miss others, Steele, you too. Peters, go. We are here for you. You have our vote. Amen. Kathleen Peters. Go, girl. We love you.
Madam Chair, we have 1 remaining speaker. Our next speaker is Kai Rubach. Kai, if you go ahead and unmute yourself and give us your spelling and address for the record, you will have 2 minutes to address the board.
Hello, my name is Kai Rubach. My address is 1512 Albemarle Court, Dunedin, Florida. I'm a biology student at St. Petersburg College, and I'm actually kind of here because I have a meeting at 4, and I was just kind of going to interject here and say a quick thing about the Douglas Hackworth property, which I'm sure some of you have probably heard about. It's unrelated, so I'm going to keep it quick, but basically it's very, very important ecologically, and there's a Facebook group if you want to help preserve it into a park. It's called Preserve the Douglas Hackworth Property, and I would highly appreciate if the commission could at some point in time add this to an agenda. And thank you.
Thank you.
And Madam Chair, we do have 1 remaining speaker with a hand up. Dawn, I do not have a last name. Dawn, if you go ahead and unmute, give us your first, last name, spelling, and address for the record, you'll have 2 minutes to address the board.
Hi, can you hear me okay?
Yes, ma'am.
All right. Hi, my name is Dawn Jenkins. I live in Leelman. Keep the keep the emergency order, don't keep the emergency order. I don't think a lot of the people who call themselves good citizens care. They're not going to wear a mask anyways. They're going to use excuses for not wearing a mask. I personally am going to wear it. I'm not going to stay at home, as some of them have said I should do, because I believe in it. I'm also not going to make someone else feel bad because they're not wearing it, because there are real reasons for not wearing it. But face shields are an alternative, and they are free. So people say I can't afford it. That's not correct. And I also want to address the folks who said you're not responsible for your neighbor. Well, shame on you. We are all responsible for each other. And for those of you who believe that God is going to intervene and make this go away, well, I want you to go read your history back at the Black Plague. They believed real hard in God, and they prayed hard, and we lost a good chunk of people. So God is not going to save us on this. We have to save ourselves. Thank you. I do appreciate everything you've been doing.
Okay, thank you.
And Madam Chair, there are no remaining speakers.
Okay, well then, what's the wish of the board? Yes, Commissioner Welch? Is that a motion?
No, I got a few comments. You're not that lucky, but I'll be brief. I did want to, again, it's great to hear from well, first, Dr. Cho and Dr. Jameson. I always feel like I need to thank you for the job you're doing because you are valued. Having the 4 executives from our major hospitals, HCA, Baycare, Advent, as well as CHC, I think brought additional knowledgeable voices to this matter. And I appreciate you, Madam Chair, and Commissioner Seal for making that happen. And we are relying on the science. I just wanted to note the letter that we received this morning from John Hopkins All Children's, from Kim Burfield, the Vice President of Government Affairs there. And she sent a letter signed by 4 physicians in the Division of Pediatric Infectious Diseases, Dr. Berman, Dr. Demois, Dr. Messina, and Dr. Thomas. Very detailed. It cited specific cases done by the National Institutes of Health, University of Pennsylvania, Duke University. In addition to that, Dr. Kors from Tampa General has been very vocal on masks, washing hands, making good decisions in public places, social distancing. So I am very comfortable that all the science is there from credible sources throughout our community and really throughout Tampa Bay. And I think we're on the right course. This notion that there would be a formula that we fall back to and that the mask ordinance would go away is a false narrative. And we shouldn't feel compelled to try to reach a target of a formula. It was always the recommendations of the health and public safety professionals along with the data. And you can't really quantify flu season. You can't really quantify what's going to happen when, kids come back from college and all those other things. It has to be a combination and making a judgment based on a combination of all those factors. So I'm still supportive of the mask ordinance. When there's a motion, I will support that. But I think this was a very productive day to get facts and science and different perspectives out there. And the medical experts who we should listen to are uniform in their recommendation. And I think it's very strong and very transparent that the community hears that. Just the final thing I'll say is, I don't like to give credibilities to some of the far-reaching accusations, but I know that Barry's working on getting us, and we already have, really an itemized breakdown of the CARES funds that keeps coming up. We know where those dollars were allocated to. We know that 56 million was there because we had a PPE issue, and that was the county stepping up to make sure that we were prepared in case there was a second wave and get us in a good position for testing and PPE and all those things. So I just want to, again, debunk that. And the notion that Dr. Cho is making money off this, or that the doctors who came here today had some kind of financial benefit, is just ludicrous. And I want to say that because I've sat through all those meetings and heard where we were, and the decisions we were made were totally based on public safety. And I wanted to say that for the record. So thank you, Madam Chair.
Thank you, sir. Commissioner Long.
Yes, Madam Chair, I'm happy to make the motion when you're ready for it to extend the mandate. I also would like to make a comment once we take that vote, because I couldn't have agreed more with everything that Commissioner Welch said. And to the comments made by some of our speakers today, very idea that any of us are taking this lightly or think that in the place that we're in, we have to pay to get good medical and scientific information is really, truly outrageous, and says to me that these folks have no idea who we really are or how deeply we really care. And lastly, I don't know. I mean, if anyone thinks that this is easy or we are taking these decisions lightly, they just couldn't be further from the truth. I probably am only getting about 4 hours of sleep a night because I worry about all of this kind of thing. And I worry about just the tone and the way in which people are speaking just seems so unnecessary to me to get the message across. We get it. You don't like it. Okay. Well, we don't like it either. And we're trying to do the very best that we know how to do. And I am impressed, quite frankly, by the information we got from Johns Hopkins. Surely there aren't too many people out there that think that isn't a credible institution, and that the words from those folks should be taken very seriously. And I do want to just suggest that we did, I think, all nod our heads in agreement that we would dearly appreciate hearing from the physicians that were on our call today, if they would get together and they would come up with some metrics that could better help us make a decision about when we might start relaxing some of these restrictions. And I venture to say they will do that as soon as they possibly can. And so I would like to suggest, and just for thought or maybe further discussion, that we delegate these type of meetings to the county administrator until such time as we can hear from them again with their recommendations and take them up seriously to make a different plan. And I'm not sure that doing this type of thing every single week is being as productive as it might be if we just had a report about where we were and how long it's going to be before we get the recommendations. And so those are my comments and my point about making the motion. Thank you, Madam Chair.
Thank you. Okay. Commissioner Eggers.
Thank you, Madam Chair. Yeah, I kind of echo the comments that my colleagues have just said. I'm ready to keep the mandate, the state of emergency in place. I just, at first, I think Commissioner Welch touched on it a little bit. I think we're going to be getting some information from the county administrator to talk about the CARES funding and what we're doing with that. It's been very transparent how we've been using it in general to get some specific information about how it's going and how the $170 million have been spent, is being spent, and will be spent, depending on which direction we go and how much extension we get will be important. And I think we're doing that anyway, but I think it's a good request from the residents to get an accounting of that. And I do like the idea of dialogue and conversations. I took note of that, and hopefully there'll be more of that dialogue and conversation. I don't have a problem trying to reach out to some of the folks that have just called in today to do that. So I'll try to do a better job of that. I did like also some of the comments that were being made from our residents about the divisiveness in our community, whether you are a pro-mask person or not a pro-mask person, and you want that taken away. And I think that's something that we just have to kind of search our own individual souls and try to do a better job of being tolerant of each other, of being caring for each other as we move forward. And I also don't have a problem with diversity of input. So to the extent that I get information from some of you who have other viewpoints, I do pass along that information to our doctors so that they can look at it and take a note of it and see if the studies are up to date or not up to date, and try to go through some of that. You all are sending in a lot of information, so not all of it can be gone through, but I am sending some of that to our doctors so that they can at least see what else is going on out there and being aware of it. And so in any event, I really appreciate the work that doctors that were here today. I thank you for being here. I'm sure that there are some doctors that are a little hesitant to come out, may have some questions about whether masks are the right thing or the wrong thing. I get that. But just know that, and I've had conversations privately with many doctors, and I haven't found one that is against the masks for yet. I'm not saying that they're not out there. I'm just saying the ones that I've come in contact and had personal conversation with. And again, statistically speaking, I don't know what, how many doctors are in favor, how many doctors are against, but we're listening to all of you. We're listening to the doctors. And right now, the predominance of doctors that we're hearing from are very much in favor of keeping the mask. And so am I at this point in time. I look forward to hearing from Barry and some of that information that we're gathering on what the other counties are doing quantitatively and qualitatively. One or two that have actually done it without masks that are doing okay. So just to hear some of the dynamics and some of the things that are going on there and what we might learn. So again, stay tuned, more to learn, and we'll continue listening. Thank you, Madam Chair.
Thank you.
Madam Chair, if you would like me to provide some of that information, I can. It's up to you.
Well, I think the one piece of information I'd like you to talk about is the fact that the health department has only received 1.9 million for test kits and PPE from the entire CARES Act.
So what people looked at is they said we set aside $55.9 million for mitigation and response efforts. That's all county response efforts. So that's PPE that we're buying. That is test kits for Dr. Cho. That is contract tracing, cost impacts and things like that. That's where he's received $1.9 million. We've spent another $2.3 million. So there's not, my point there is there's nothing going that's helping his bottom line. It's additional expenditures as a result of this. We're not reimbursing anybody's salaries or, helping with anything that has a direct line on their bottom line. It's all extra cost associated with this pandemic. We've spent $2.3 million in PPE stockpile. We've got $4.4 million in contract tracing and testing. We've got $8.4 million where we're going to reimburse cities the FEMA match portion of their cost. And then we've got the other things, our local business grants, $16.3 million, $3.1 million for licensed child care, $10.3 million awarded to individual and families, and $8.9 million we've awarded to nonprofits. All of these are in our check registry. So these are approved with each agenda, but they're throughout different agendas. What I said I would do, and we're going to have that, but we have to pull it from different sources, where we'll put kind of a check registry of every dollar spent, and that way we'll put it on our website. It's very transparent and available for everybody to see. But that at least gives you an idea of the dollars, where the expenditures have been made. What they're looking at is what is budgeted versus what we've actually spent.
Okay. Well, one of the things that came up today again was the the issue with people being harassed, and maybe Sheriff Bob, you could speak to this a little bit. I actually got an email during the meeting about someone who went to a recreation center and without a mask, who had a medical condition, and ended up having the police called on her and her young child who didn't have a mask on. And, you know, it is getting out of hand a little bit. And I'm just wondering if you can give some parameters to how do people avoid, you know, what should they do? There was a person last week, I don't think you were here, that had a inhaler slapped out of her hand. Somebody said, call the police. Well, I think that's an appropriate response, but you know, at what point would you want to be called to intervene in something that was going on like that? Because it's starting to get pretty ugly out there.
Well, of course, there's no place for anything like that. We should have no tolerances for that. And the other side is everybody needs to be tolerant of each other. I do think that there is confusion. In fact, I know there's confusion out there, and that this ordinance was very narrowly crafted, and it has a number of exceptions. I would actually encourage people to go back and read the ordinance and read the exceptions that are in there. There is a requirement that people wear facial coverings, but it is in certain places. There are a number of exceptions, including anybody that has a health condition. And remember what it says in the ordinance is that you're not compelled to produce any documents. You don't have to answer any questions. You don't have to do anything other than say, I have a health condition and I'm unable to wear a mask, and you're exempted from the ordinance. Now, with that said, is that this is also very important for people to know and to understand. Anybody that operates any business, any place, can control access to that business in any way that they want. And I'll just use as an extreme example. This is extreme. If they say, I operate a store and I only want people wearing red shirts in the store, and if you don't wear a red shirt, you can't come into my store, they can lawfully do that. And they can exclude anybody from their business anytime they want, under any circumstances, for any reason they want, as long as it's not, of course, discriminatory based on a protected status. But let's just assume that if you don't have a red shirt, you're coming in, they call the police and say, I don't want this person here, they're not wearing a red shirt, and I want them trespass from my property. I want to issue a trespass warning. And if the person doesn't leave, then we're going to do what we have to do and take care of business and enforce the law. Well, the same thing applies to masks. Just because somebody is exempted under the ordinance is that business owners can be more restrictive. They can be stricter. So even when the time comes, and whether it's next week, next month, next year, or next decade, at some point in time, you will rescind this ordinance. But at that point in time, if businesses still want to require everybody wear a mask, they have an absolute right to do that. And if they want to exclude people. So, you know, as people are facing this, now, by the way, we're not getting many calls on this at all where there's issues or problems or these intolerances have risen to a level. So you may be hearing some things about it, and I'm not saying it's not happening, but it's not prevalent, and we're not getting a lot of calls. So the situation is just that, is that there's a number of exceptions, and if somebody falls outside the ordinance, but an individual business, an individual location has an absolute right to insist, regardless of whether you're exempted from medical conditions or anything else. They can say they don't care. Everybody in here will wear a mask, and that's regardless of the ordinance or its exceptions. And if they don't want you there, they can cause you to be removed, and they can call law enforcement. Law enforcement is going to come out and respond. But that's just because they don't want you there for any reason that they so choose. So that's the situation. But no, Commissioner, we're really not getting a lot of calls on this. But I would encourage anybody where somebody is not acting tolerantly and somebody is being rude, inconsiderate, or certainly if you're being threatened, by all means, call immediately, and we'll come out and we'll deal with the situation and we'll take the appropriate action. Nobody should be treated that way. Everybody needs to be considerate of others, especially in these times, and all the time, really, but especially in these times.
Okay, thank you. Okay, anybody else? So I believe we have a motion from Commissioner Long, second from Commissioner Welch.
Yes.
Okay. If there's nothing else, all in favor, please. I'm sorry, go ahead. What?
So I did have a question on Commissioner Long's
Sorry.
secondary suggestion about
Thank you.
doing this every week and perhaps letting the doctors and Dr. Jameson and Cho and whoever admin assigns to work on this. Of course, I know Charlie's going to get me for saying this, but I've only got a couple more meetings, so this really isn't going to affect me. But I think we've heard the arguments aren't changing. And I think that's a good idea from Commissioner Long. So I didn't know if you wanted to include that or handle it separately.
Well, I think we can handle it separately, but I would also agree. As you know, I brought that up several weeks ago and it's only gotten uglier. So Commissioner Peters.
To get to Commissioner Long's original point and the issue that Commissioner Welch just brought up. And again, I agree with you, Madam Chair. I would take 2 votes. The first vote, which you already have a motion and a second on, is to extend the current local state of emergency. What an alternative action that you may also bring forward, and I would recommend it be separate, is that you would delegate the authority to do these incremental extensions of the local state of emergency, which, as we've discussed, you're confined to by state law for only 7 days at a time, which is why we're back here every week renewing that state of emergency. So you could take an action by resolution to delegate that authority to the proper authority. It could be the county administrator, it could be the chair, another commissioner, maybe chair, vice chair. But I think any of those 3 would be appropriate. And we could you could take that action today and we could reduce that to a resolution for execution. But that's what you would be doing, is delegating the authority to do these 7-day extensions of the local state of emergency. Now, your mask ordinance is tied to those extensions, and it would stay in place unless and until the local state of emergency expired, or alternatively, this commission took action to repeal the ordinance.
Right, just as it is now.
Correct.
Right. Commissioner Peters.
So, I got lots of thoughts on this, and I was quiet, but I'm not anymore. But, when we put the mask ordinance in place, I think our numbers were higher than they are right now. And we're now in our 5th week of school. People have been in college almost 5 weeks now. We're in our 3rd week of Labor Day. Dr. Cho, you said flu season is the worst in January. I mean, do you consider giving people a break and let them have a break, or do you keep towing the line? What do you do? I'd be concerned about, and I get you're frustrated with the same people calling in over and over again and saying the same thing and so forth. But I think because we serve them, and I get your frustration. I hear you. But we serve them, and they're the ones that put us in this position. And I would hate to take away the opportunity for them to speak about something they feel very, passionate about. And I know they're frustrated. I get it. I do. And it is frustrating when we don't keep, politeness and so forth. But I am very hesitant to take away their right to speak every week on this and us looking at this every single week. If the numbers go down and they're down to a 1%, I mean, right now, one of our biggest hospitals that had patients in it has 11 COVID patients in the whole hospital. Only 11 out of the entire hospital. And so we did this to flatten the curve. We did this to protect the hospitals. And when we first did this, the hospitals didn't know how to treat. We were treating it wrong. Now we are so much more knowledgeable. Yes, medical profession says we should keep the line and keep the mask, but I just would hesitate from taking away an opportunity for the people to speak their voice. I think that's a slippery slope that we should never, whether we agree with them or not, whether they're nice to us or not, I think that's their right, and I would caution against taking away that right from them.
Commissioner Seal. Can't hear
Commissioner
you.
Steele, your audio is still not working.
Bummer.
Check your audio source. It's at the bottom. We'll come back to she wants us to come back to her, I think.
Mr. Justice.
Yeah, thank you, Madam Chair. You know, when we talked about it before, there was going to be a long break, a several-week break of scheduled meetings, and that's why we had talked about delegating the authority. But we have meetings scheduled right now on the calendar for October 1st, October 6th, October 15th, October 20th. So we're going to be meeting every week in October anyway. So I don't see a big need to delegate it. I think, you know, let's just kind of keep working through it.
Commissioner Eggers?
Yeah, I'm certainly going to support the extension for now. I'm glad we continue having the conversation. I think it's extremely healthy. It's really what I wanted back in August, is to keep having this conversation. I think it's important for us as the policymakers to do that and to hear from each other. We hear from all the experts, we hear from our residents, and I certainly want to keep the weekly meetings going so that we can continue to hear from our residents. And it's just what we're supposed to be doing. So I would not like to delegate that authority for now. Thank you.
Thank you. Commissioner Seal?
Okay, can you hear me now?
Yes, yay.
Excellent.
Okay, turned some stuff off and rejoined the meeting, so I'm glad that it worked. Well, first of all, as you know, under Citizens to be Heard, anybody can call about any subject related to, you know, the county. And so it doesn't limit anyone who still has concerns and wants to voice their opinions about mask or no mask. I would like to support the local state of emergency motion, and I would like to support delegating the authority, but I would like to have a timeline for the doctors to come back with the metrics so that we can, I know Jewel will have to talk about what that kind of time period would be, 2 weeks, remember, to be able to advertise and everything else like that. So I'd like some kind of definitive, or at least goal date for being able to have this discussion. I want to thank, it was already mentioned, but the letter from the infectious disease doctors from Johns Hopkins was an incredible amount of information. I don't know whether we can post that on our website. It is a public document now that we've received it, but it is incredibly interesting information that I think the public ought to see. So with that, I am finished. However, I saw a sign the other day and it said, "Be kind." And it says, and emphasize the I in kind. So I really am very troubled about the lack of kindness during this time and the lack of respect for everyone. The lack of civility. This is not the Pinellas County I was born into and grew up in. And so I urge all citizens equally to, it is a frustrating time, it's a scary time, but it's also the time to be kind. And that's all I'm saying.
Thank you. That's a great note to end on. Okay, we have a motion from Commissioner Long, second from Commissioner Welch. All in favor, please raise your hand. Okay.
That's to extend, right?
That is to extend the local state of emergency.
Commissioners, back on your other item, you know, I'd like Dr. Cho to, you know, give you an idea about talking with the other doctors. We've been, you know, you asked us to look at this. We put our data group to look at other examples to try to find, and I would rather use the term criteria than just data, because there's so many factors that go into making a decision about mask or no mask. We did try to look at trends, as you had asked, regarding counties that had mask ordinances and those that didn't. And what we saw was that there were a lot of things occurring simultaneously. We saw where you didn't have a mask ordinance, you also had national policies at Publix and others that required masks. So there was a lot of things coming together. They came down, not quite as on the same trajectory, but we can't necessarily quantify that back to one or two things. It was the same way with trying to find a fixed set of data set or criteria that we would use to make a definitive answer. It almost comes down to kind of the conditions on the ground that we've talked about. So I would welcome, their input on that. But I do think that it's going to be, and Dr. Choke, you can certainly weigh in on this. It'll take them a couple meetings to be able to come up with their thoughts on it. And I think it'll be their thoughts versus, a formula that says, at 2% for 2 weeks equals, a no mask policy or something like that.
Right.
And I can circle back. Dr. Feynman did just mention that, and I actually did not have a conversation regarding it coming from the healthcare system to sort of weigh in. But in terms of the time frame, I definitely will grab a few of those on the call, along with Dr. James Censar, to volunteer you to sort of have that discussion. I do suspect, though, since these are a huge hospital healthcare system that spans multiple counties, they're probably looking at it from a regional perspective. So to have that insight is, I believe, what they're looking at. And to Barry's point, some of those metrics are difficult. There is no set guidance on a metrics. I think the experts are going to continue to recommend masks really throughout the pandemic, as it is one of the most effective tools. But just coming in with that, the unknowns, the variables, the fact that they're seeing second waves in Europe is concerning, as well as sort of the increased cases in the Midwestern states here in the U.S. So again, there is that chance. A lot of experts do have concerns about a second peak, but what I can't say is we'll have those discussions with Dr. Feynman, Dr. Anand, among other partners, in terms of time frame, probably 3 weeks.
And Dr. Cho and I also have reached out to our counterparts both in Hillsborough and in Pasco County. And I reached out to them regarding are there things that we could work on together? Because as we read, people are going in between the counties. They're certainly not staying in one place. So we began those discussions. Again, we've run into the same difficulty with defining, what that would be. So what I can work with Dr. Cho on that because the hospital systems are in the same position.
I do think it's important to have a regional response and, a change. Commissioner Long, you had your hand up?
Yes, Madam Chair. I just wondered if you needed me to make another motion.
Yeah, if you want to.
Okay, well then I would like to move that we delegate the extension of the mask mandate each week that we've been doing per our ordinance to Barry until such time as we hear back from the physicians, with the caveat that we would like to know, hopefully in the next day or two, or whenever Dr. Cho and the physicians are able to meet, when they think they might be able to come back to us, so that we know and there is a time certain.
I'd
as
second with
Commissioner Fields
the clarification.
But it was the state of emergency, not the
Oh,
mask.
did I misspeak? I'm so
Right.
sorry.
With that understanding, I'd second that extension of the local emergency delegation.
Okay. Commissioner Eggers?
Yeah, listen, I'm not going to support that because I do think we need to continue hearing from our residents. But I also think, I'll take the opportunity now to apologize to the county attorney from a couple of weeks ago when I got very frustrated with the notification for ordinance removal. I was more in the moment about having another roadblock to getting something accomplished. But I do think it's fair for our residents to understand that the likely course of this would be that 2 or 3 week notification to rescind the ordinance, and not the other alternative, which is to eliminate the state of emergency as a way around it, because that would be akin to doing something without giving proper notification to all residents, that would be seriously undertaken. So I don't see this commission. I'm not speaking for the other 6. But after, again, thinking back on that meeting last week, and then again, as we've been having these discussions, that is a possibility. I'm not saying we can't do that, but I think that the more likely scenario would be eventually to give some notification at a meeting that in 2 weeks or 3 weeks down the road that we will be considering that course of action. So I just think if I would support continuing to have the meeting, understanding, not giving the expectation that we're going to be taking a possibility of taking a vote every week. That's not what's on the table in all likelihood. But I still think it's important to hear from our residents. I'm sorry. I think if it gets some of the frustration out, whatever. I think this is a great and a healthy way to do it. So I'm not going to support the motion on the table. Thank you, Madam Chair.
Yes, Commissioner Welch.
Yeah, and I respect Commissioner Eggers' viewpoint, but I think we're saying the same thing. The only thing this does is it removes that vote every week on the extension of the declaration of emergency, because it's linked to the mask. What folks are trying to get to is the mask ordinance. And I do think we need to decouple it, like you said. And folks can still call in, as Commissioner Seal said, under public comment, citizens to be heard and speak to it. But it takes that voting decision every week on the extension of the emergency order, which folks are really using as a conduit to get to the masks. It takes that off the table. And I do think, like you said, the proper way to address the mask issue is that public notice and public hearing, 2 to 3 week process. So I don't think we're saying different things, but I respect where you're coming from. But folks can still call in and speak.
But just for clarification, then maybe I misunderstood it. I thought we were talking about deferring or delegating that weekly meeting decision to extend the state of emergency. So that we, aside from the 2 meetings a month that were regularly scheduled, that there wouldn't be the need to have those other meetings to extend the state of emergency. That's where I thought we were going with it. So if we're going to continue having that weekly meeting to hear from our residents, then that's fine. I mean, because and then I would agree with your statement, but I think the direction, well, at least I understood the direction we were going was to get away from the weekly meetings and to defer or to give that power to the chairman and the county administrator. So just clarification on that point would be helpful. Thank you.
Well, I think that is right. We will have 2 regular meetings a month and probably 2 work sessions because work is kind of piling up. But at those work sessions, we've been taking public comment that sometimes goes on for hours just because we have to vote on extending the state of emergency. It won't cut down on people making comments during a regular meeting, during citizens' comment, but we don't take citizens' comment during a work session. So that is the difference.
Thank you for the clarification, Madam Chair, and that's why I'm not going to support the motion.
Okay, Commissioner Justice.
Thank you, Madam Chair. And again, if we weren't planning on meeting, but we are planning on meeting every single week in October. We have our agenda preview and then whatever work session materials we have and on the Thursdays, and then we have our regular commission meetings on Tuesdays. So we're still going to be here every week. So if we weren't and we wanted to delegate, I think that would be appropriate. But since we're scheduled, I just don't see I don't see the cost benefit there of not having that discussion every week since we're going to be here anyway. So I won't be supporting it.
Commissioner Long.
Well, it might be a small point, but I think you're missing the small point. And the small point is something that Commissioner Gerard just alluded to. Our work is piling up because we have never taken public comment at our work sessions. The work sessions have always been for us to talk amongst ourselves, to work on our agenda. And because we haven't been able to do that when we're taking public comment for hours at a time, things are not getting done that our citizens are waiting for us to get done. So it isn't fair to all of the rest of almost 1 million people in this county that we are making these decisions based on what, 20 or 30 people that call in every week? I mean, that is a lot of people that are calling in, no doubt about it. That said, there's 1 million people in this county. And so I try to weigh the balance, because from the folks that are emailing and talking to me and that I'm interacting with when I'm out and about in the community, they're happy with what we're doing. And I don't see a huge group of people that are not wearing their masks. The places I go, just about everybody is wearing their mask and they're being very compliant. So I just wanted to make that point. It isn't about not letting people talk. It's about being able to get our work done, which is another reason why we're supposed to be here. Thank you.
Thank you. Commissioner Eggers, sorry.
Yeah, just, and again, with all due respect, and I do respect each of you and your thoughts about this, I do think that the number of people that will call in, knowing that we're not going to be voting on a mask ordinance that particular meeting, will be a lot less than it was last week, when I may have been part of the reason people were thinking we were having a vote that next meeting, and we were inundated with calls. We were in it. So again, my apologies to residents for that we were going down that road. Having said that, I do think that expectations are important. And I think the expectations for last week were different than what they would be going forward. And so I don't think we would be hearing from that many to begin with. If all of a sudden we had 50 callers on the line, limiting the time that we've been doing, limiting the time for discussion would be appropriate as well. So anyway, that's all. Thank you. I'm done.
Well, frankly, we haven't voted on masks in months and people have been calling. So Commissioner Peters.
I hear you, and Commissioner Long, I hear what you're saying, but we have yet not finished a meeting. So any work that's on the agenda has gotten completed in every single meeting, even with people calling in. And I think it's a real slippery slope when you represent the people that you don't want to hear from them, especially on something that is so important as this outbreak and this pandemic. So I absolutely would never support taking away the ability for those citizens to call in, particularly on this issue, every single week if they want to speak. We represent them and we need to hear from them. Whether we agree with them or not, whether they're polite or not, whatever it is, we work for them, and I think we should always, always, always allow them to have a voice.
Well, I just want to say it's pretty absurd to think that we're limiting people's ability to talk when every week we listen for hours and we listen politely and we acknowledge them every week. We are not limiting anybody's ability to communicate with us. We also get thousands of emails and we attempt to read them all. How much more do you want? Okay, so we have, that's all I have to say about that. We have a motion from Commissioner Long, second from Commissioner Welch. Do we have anybody else wants to speak to this? All right, all in favor of delegating this authority to the county administrator, not to me, please raise your hand. Okay, we have 4 opposed. Please raise your hand. Thank you. Motion carries 4-3. Okay. Can we move on?
And Madam Chair, I would just add for the record, we will put together a language and work with the county administrator that memorializes your action here today in a resolution.
Right, okay. So which we would have to vote on?
No, you've taken action. Well, we will reduce that to a resolution that reflects your action taken today.
Okay, thanks a lot. Okay, item 25, and I'll give you a second to get back to it.
See if we remembered where we were at. Okay.
I wrote it down because I never remembered.
Item 25 is the Pinellas County Health Health Program Hospital Provider Agreement renewals. Okay, so these are our renewals with this is the first option of renewal, and with an amendment number 2 with Tarpon Springs Hospital Foundation, Advent Health North, Baycare Health System, first option renewal agreement with Bayfront Medical Center, Bayfront Medical Center for Hospital Services, and for Pinellas County Healthcare Program for the Healthcare for the Homeless program.
Move approval.
Do I have a second?
Yes, second. I'm sorry, my mic was off.
Oh, okay.
Mine too.
Do we have any questions, comments?
This time, if there are any members of the public that wish to comment on agenda item number 25, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And Madam Chair, there's no one that wishes to comment on this agenda item.
Okay, thank you. If there are no questions, all in favor, please raise your hand. Thank you. Motion carries. Commissioner Justice, did I see your hand? Opposed? Okay. I'm assuming he voted yes. Okay. Item 26.
This is an amendment to the interlocal agreement between the City of Clearwater and Pinellas County pertaining to the Clearwater planning area. This ensures that unincorporated residents and business owners have standing to participate in proceedings for city's comprehensive plan. This is a third amendment, would take us through September 30th, 2030.
Well, it's hard to believe it's been 20 years already since these went into place.
Wow.
Anyway, yeah. Questions? Motion?
Move approval.
Okay. Commissioner Welch and Commissioner Long. Do we have any public comment?
At this time, if there are any members of the public that wish to comment on agenda item number 26, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And Madam Chair, there's no one that wishes to comment.
Okay, thank you. If there are no questions from the board, all in favor, please raise your hand. Thank you. Item carries 7-0. Item 27.
This is change order number 1 to a contract with Cone and Graham for the Betty Lane at Sunset Point intersection improvement project.
Questions?
Move approval.
Second.
Okay. Do we have any questions? Do we have any commenters, Brian?
At this time, if there are any members of the public that wish to comment on agenda item number 27, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And there's nobody that wishes to comment, Madam Chair.
Okay. If there are no questions from the board, all in favor, please raise your hand. Okay. I can't tell if Commissioner Seal's there or not.
I think she stepped away, Madam Chair.
Okay, item carries 6-0 then. All right, item 28.
This resolution designating Melanie Weed with our Public Works Environmental Management Division Director as a certifying agent to the county to receive Restore Act funds. Andy Squires retired. As a result of his retirement, that we need to appoint the new person for this purposes.
Move approval.
Second.
Okay, Commissioner Justice.
Thank you, Madam Chair. And without having our in-person meetings, we didn't get a great chance to thank Andy. His work on Restore and the Gulf Consortium and the Tampa Bay Estuary Program and everything to do with beaches. Andy just was a tremendous asset for Pinellas County and our residents for so many years. So if he's watching, I hope he's not, but if he's watching, I just want to publicly thank him for all his good work and support Melanie as the designee. Thank you, Madam Chair.
All right.
Thank you, Commissioner Justice.
Do you have any questions? Comments from the community, Brian?
At this time, if there are any members of the public that wish to comment on agenda item 28, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And Madam Chair, it appears we have 2 members of the public that wish to speak on this item. We'll start with last 4 digits 4945. If you can unmute and give us your first, last name, spelling, and address, you'll have three minutes, Madam Chair.
Yeah.
3 minutes to address the board.
This is David Happy, 850 East Lime Street in Tarpon Springs. The state of emergency was on the agenda. The delegation of your duties was not on the agenda. Completely inappropriate to not let people speak once they understood what your plan here was. I'm very saddened today to live in Pinellas County. Very saddened that you're my representatives, Barry. I'm glad that you think this is funny, but I appreciate the time of those that were considerate of the residents, and we will be in touch. Thank you.
Thank you.
Madam Chair, our next speaker is Dave Waddell. Mr. Waddell, welcome back. You'll have 3 minutes to address the board.
Hi, everybody. Honorable Chair, Board, and staff. I can't agree more about the respect issue here. I know sometimes I get a bit emotional, but I love this place, and I just thought I'd take this opportunity since we're talking environmental. It's amazing that we live in paradise, and then our folks sometimes don't realize just how beautiful what's around us means to all of us, and we got to stop fighting. But I understand we just recently lost Renee Vincent up to Tarpon Springs. Wow, what a great staff member. And through the years, I've been blessed. I mean, I can name off a few. One was David Healy, and another was John Cueva. We got to hold on to our good people. And you guys are doing a great job, all right? This stress has been hard on everybody. But I do want to say, and I want to get back to this, we got to be proactive and look ahead, okay? Ventilation is going to be key in our future in dealing with this virus and trying to acclimate, keep the businesses going so we can get them back up to 100%. And I'm telling you, if we're going to spend money, let's at least research the topic. Commissioner Eggers, I'm sure you can appreciate that line of thought because there's so many unknowns. But if we realize that these ventilation systems can actually recirculate, and as we're trying to wean down and get down to 1%, 2%, in the meantime, we got to do the contact tracing. I'd like to see more money go towards that. But environmentally, we are all blessed. And to have such a great staff, thank you. And God bless America, and God bless all of you.
Thank you.
Madam Chair, we have one other speaker, Virginia, I believe Virginia Frizzle, but Virginia, if you'll give us your first, last name, spelling, and address for the record, you'll have 3 minutes to address the board. Virginia, you'll have to unmute on your side.
I just wanted to say Virginia Dassler, DASSLER,
Oh,
Crown Drive, Largo,
thank you.
Florida. We do need to be heard weekly. I think it's important. I do also believe it's in your charter rules and the Constitution that we're heard weekly. And this was effective till October 2nd, I thought anyway. So you led us to believe we could talk now, when really, I believe this was signed till November or October 2nd. Am I wrong, incorrect? That was already signed for that day. And then you allow us to speak and then you criticize us. I don't get that. Again, I believe it's in your charter rules that this has to be done weekly. Thank you.
And Madam Chair, there's nobody else that wishes to speak on this item.
Okay, did she get cut off or what?
Oh, no, I thought she was done with her comments. I'd be happy to bring her back.
I think,
Hold on, let me.
I thought she was in the middle of a sentence.
Virginia, I'm sorry, did I cut you off?
Pat, I do appreciate you acknowledging that. I do appreciate
I'm
that.
sorry.
I was done it, but I do want to say thank you, Pat, for
Okay.
acknowledging that.
Thank you.
Thank you. He has better ears than I do. Okay, we have a motion from Commissioner Peters, second from Commissioner Long. I forget what item, for item
28.
28. Thank you. It's been a long day already. All in favor, please raise your hand. Thank you. Item passes 7-0. Item 29.
This is an approval of a Medicaid public emergency medical transportation letter of agreement with the Agency for Healthcare Administration to participate in the extension of the PEMT program via intergovernmental transfer program. This provides public entities, Medicaid recipients to enroll in managed Medicaid assistance programs. It's a net revenue of little over $3 million.
So moved.
Do I have a second?
Second.
Thank you. Okay, do we have any public comment?
At this time, if there are any members of the public that wish to comment on agenda item number 29, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And Madam Chair, there's nobody that wishes to comment.
Okay, any questions from the board? If not, we have a motion from Commissioner Welch, second from Commissioner Eggers. All in favor, please raise your hand. Thank you. Item passes unanimously. Item 30.
Item 30 is a resolution to receive Emergency Medical Services Trust Fund monies for pre-hospital emergency medical services. Revenue of $122,000 be received by the state trust fund. No matching funds are required.
So moved.
Okay. Okay, we have a motion from Commissioner Welch, second from Commissioner Eggers. Do we have any public comment?
At this time, if there are any members of the public that wish to comment on agenda item 30, the resolution, please hit *9 on the telephone or raise your hand virtually in the Zoom meeting. And Madam Chair, there's nobody that wishes to comment.
Okay, thank you. If there are no questions, all in favor, please raise your hand. Thank you. Item carries unanimously. Item 31.
This is appointments to your WorkNet, Career Source Pinellas Board of Directors. One appointment is a business seat expiring on June 30th, 2022.
All right. Okay.
Madam Chair, I would suggest, since there's only one applicant, Beverly Frank, that you go ahead and use the raising of the hand vote.
Right. Okay. I need somebody to make a motion, I guess.
Move the appointment.
Commissioner Welch.
Second.
We have a second. Do we have any public comment?
At this time, if there are any members of the public that wish to comment on agenda item 31, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And Madam Chair, there's nobody that wishes to comment.
Okay. If there are no questions, all in favor, please raise your hand. Thank you. And you got the motion and second, Peter?
Yes.
Okay, thank you. Item 32.
This is a budget amendment, number 4, to realign appropriations from our general government cost center to the supervisor elections within the general fund. And this is for the cost associated with transferring clerk personnel over to assist with elections. But as you can see, this kind of explains the approach we're using with the CARES Act money. That is an eligible CARES Act money. We're going to pay for it out of reserves. At the end, once we've fulfilled all of our public requests for individual assistance, business assistance, then we'll determine whether or not we reimburse that out of CARES fund or whether we apply for FEMA dollars to be reimbursed. But right now, this just aligns it and removes it from reserves.
Okay.
I would move approval.
Okay.
Second. With a question.
Go ahead.
Do we have a status report as to whether we are ready for the November 3rd election with enough poll workers at this point?
Yeah, I'm looking over at staff and they said yes. So so Jill just talked to them yesterday and they said they're in good shape. Obviously, both cities have volunteered staff along with our own county employees and other community volunteers. I know Supervisor of Elections been, going out to businesses and everybody saying we need assistance to be able to fulfill during this critical time. So big congratulations to everybody that stepped forward to assist in this, critical process.
Yes, and thank you again. I think I'm not sure how we would have conducted elections this year without county staff and constitutional staff. It's really
If
very
there's
great.
anybody less listening, Jill just reminded me, don't stop now. We need more. So if you're
Oh,
listening,
okay.
and you want to volunteer,
Okay.
please. Yeah,
All right.
we need more.
Okay. All right. Do we have any public comment?
At this time, if there are any members of the public that wish to comment on agenda item 32, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And Madam Chair, there's nobody that wishes to comment on agenda item 32.
Okay, so we have a motion from Commissioner Seal, second from Commissioner Long. All in favor, please raise your hand. Thank you. Item carries unanimously. Item 33, Madam Attorney, do you have anything?
I have nothing.
Okay, Mr. Administrator, do you have anything?
2 items, as you know, starting yesterday, Kevin Knudsen joined our staff as one of the assistant county administrators. Jill Civil Board will then move over into more of the larger line departments, public works, solid waste, and utilities, all of those areas, and parks, while Kevin will assume more the administrative functions. So that'll be airport, economic development, administrative services, CVB. So second down the job, so we welcome him. The other one we're excited to announce as Carol Strickland will be moving over into our housing and community development department. This will be a good move for her, but she brings a tremendous amount of experience doing the same position in Largo for a number of years. And so we're excited to wait for another month and have her on board. But those are 2 good additions that we look forward to working with her.
And Largo hates you. Just saying.
They almost took a double whammy, so at least they only took one.
Okay. Okay, so we have a item 35, appointments to the Youth Advisory Committee.
So an email has been sent to all of you with the slate. We're recommending 35 applicants for this year. 16 are returning, and based on our rules, they can return. They have that preference. So we wanted to bring those 16 back, and then the additional would be added on the 3rd to make 35. The attached spreadsheet you have shows you who the top 35 are. The green includes the 16, and then you can see up to 35. We did use a scoring rubric. We can send it. We're going to send it to board records. We didn't include that. We've sent you so much information already. If you saw Ashley's previous email, you saw the scatter map on where the schools are, where our applicants are from. And so I think this group, I'll tell you this, the applicants are really great kids. I think they're going to be amazing. Their resumes were incredibly impressive. We did provide all that to you in the spreadsheet that Ashley sent out. So if you want to look at the resumes, you certainly can, but the comments that they made, we put in the things so you can easily look at their comments. But I think the way they ranked it, it was the best they could do for equity, and everybody was scored on the same thing, the same way. And so this is my recommendation. You had 48 applications, and I think 35 is the max we can handle. And so unfortunately for those others that didn't make it in the top 35, they can apply again next year. Many of them are freshmen. So they've got several years in which they can apply again. But I'm really proud of these kids. They've done amazing work, and I know next year will be even more amazing.
Okay. Well, so we have a suggestion to just move the slate that
that would be the motion that I would make, and I'd look for a second for that.
I'll second that.
Okay. Do we have any questions?
Yeah, just a question.
Go ahead, Commissioner Welch.
So Commissioner Peters, I'm looking at the Excel spreadsheet, and so there's green shading on the first
16.
Right. What is that?
Those are the current members that want to reapply.
Okay. And so you're recommending all the way down to row 35.
Yes, to include 35.
Which is DeAndre Hendricks. That's the last one.
That's the last one.
Okay. Thank you, Madam Chair.
Okay. Commissioner Eggers?
Yeah, first of all, I wanted to congratulate Commissioner Peters and Ashley for doing a great job. I'm overwhelmed with the amount of people that have gotten engaged in this, and really to the kids, kudos to you. You're gonna get a lot out of it, and we're gonna get a lot out of having you involved. So thank you again, Commissioner Peters, Ashley. Looked like you had a good mix on the grades, grade level, freshmen through seniors. And it looks like I didn't see enough of it in time. So a good representation throughout the county.
Mm-hmm.
Yeah, okay, I'm not here nodding. So that's great job. Again, I'm in support. Thank you.
Thank you. Anybody else? Commissioner Justice?
Yeah, thank you, Madam Chair. Just wanted to add my appreciation to Commissioner and her staff. When we first got the first Excel sheet and we started to try and wade through some of those, the names and trying to figure out where they were from and what schools so that we had some geographic balance. And then when we got the slate today, and of course, most importantly, that the committee will be elevated this year because I do see representation from the Bogasega High School. So I'm happy about that.
You said elevated?
All right. Hey, we're being civil here. Stop it. Okay, anybody else? Do we have any public comments?
At this time, if there are any members of the public that wish to comment on agenda item 35, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And Madam Chair, we do have one member of the public that wishes to comment, Mr. Dave Waddell. Dave, welcome back. You'll give 3 minutes, sir.
Well, thank you, folks. Nothing like a little civility. I wanted to reflect back on County Administrators Burton. A lot of reorganization has gone on. I'm just getting familiar with it again. I didn't even know we lost Renee Vincent, but I have spoken with and worked with Carol Strickland, and that's a real win for the county. If we can really integrate her on both the affordable housing and on your plan of 250 acres of environmentally sensitive lands, there's been a lot of confusion about the process of the acquisition and whatnot. That hasn't really been spelled out. And I'm hoping that maybe we can make this an agenda item. That was a goal that the county set about 1.5 years ago. And I'm looking forward to some clarity on that. I've been following it. I sat on the Parks Board for 7 years. We have a lot of commercial land along 19 that's currently vacant, that's in the transportation network that is not really being utilized. And the integration of that along a major arterial, my goodness, the sky's the limit. But we can't tear down the old growth that we still have left. And I think you guys know what I'm talking about. The Douglas property, well, we don't want to see ourselves in a situation like that again. And that's where planning comes in.
Dave, we're talking about the Youth Advisory Committee right now.
Right, but I had my hand up earlier when we addressed the reorganization, and Carol Strickland was brought up, and that's why I wanted to make my point and spoke at this agenda point. But
okay. Thank you.
Like I said earlier, you guys are doing a great job, but if we could get some clarity on what I'd mentioned. Thank you very much.
Thank you.
Madam Chair, there's nobody else that wishes to comment on this
Thank
item.
you. We have a motion from Commissioner Peters, a second from Commissioner Long. There are no further comments. Please raise your hand for aye. Opposed? Motion carries unanimously. Item 36, Construction Licensing Board.
Item 36 is the appointment to the Pinellas County Construction Licensing Board for a 4-year term. This is for one appointment for a licensed plumbing contractor. There are 4 qualified applicants: John Ware, Wayne Ritchie, Christopher Love, and Wayne Diley. I recommend a voice vote from each commissioner, Madam Chair.
Okay, thank you. Yes, Commissioner Justice.
Thank you, Madam Chair. Unless it was somewhere that I didn't see, the standard applications and resumes that typically are with these applicants, I didn't have in my email. I didn't have on the Granicus or on the attached on the public facing documents for the website. So all I know about these are the comments on the right column there. And I didn't know if other people had more information, if I missed something, but right now all I know is their name and the company they work for.
Well, I went to Lakewood, so I found it. It's in.
Found it
It's in
too.
the plumber's packet.
Granicus.
Commissioner Peters.
I'm sorry, Charlie, it's in the PCCLB plumber's packet. I had a hard time finding it in the beginning too, so Commissioner Welch must have us both beat. But I don't know if you want to vote individually, but if you're just looking for a nomination, I would nominate Christopher Love. I think he would be exceptional on that board, but I don't know how you want to do it. Sorry, Madam Chair, I shouldn't have interrupted.
That's a
Until I
good
had the whole plan.
Jeanette, do you have a suggestion how we do this?
Sure, I would suggest that we just go ahead and take a vote from each commissioner. I can call them out individually and then they can announce who they would like to nominate or support.
Question,
Okay.
Madam Chair. Question.
Go ahead, Commissioner Welch.
Perhaps we can give Commissioner Justice a few minutes to read that. Could we go to other items? Just a suggestion.
Commissioner Justice, do you want time to read it?
No, I'm not. It would, unless we came back after the break or something. It's if other commissioners know other people. Commissioner Peters had a suggestion, but if other commissioners know one of the other applicants, I'd love to hear that information as well.
Okay. I don't know any of them, so there. Commissioner Welch.
Didn't we do it right before the public hearing?
Yeah, why don't we wait until 6 o'clock? Okay. Excuse me. I just kicked myself out of the agenda, sorry. Item 37, Suncoast Health Council.
Item 37 is for appointments to the Suncoast Health Council. We need 2 in the healthcare provider category. However, there is only 1 applicant, Melissa Johnson. We need 1, I would suggest raising hands for that vote. And then we need 1 in the healthcare consumer category. There's 2, Alyssa Havish and Mary Bennett. And I would suggest a voice vote from each commissioner for the healthcare consumer vote. So if you want to start with Melissa Johnson, that would be my suggestion for the healthcare provider.
Move approval.
If she's the only, yeah. Who said
Second.
that? I don't know who said that.
I did.
No, I know, but.
Second.
I have Peters as a second, but I didn't hear who motioned.
I didn't either. Commissioner Seal. Okay. Okay, we have a motion from Commissioner Seal, second from Commissioner Peters to have Melissa Johnson be the healthcare provider. All in favor, please raise your hand. Oh. I forgot to ask for public input.
At this time, if there are any members of the public that wish to comment on agenda item 37, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And Madam Chair, I don't think there's anybody that wishes to comment.
Okay, well, okay then. All right. Why don't we poll the board about the healthcare consumer?
Sure. So for the healthcare consumer vote, we have either Alyssa Havish or Mary Bennett, and I'll go ahead and start with Commissioner Seal, please.
I'm sorry, did you say you're starting with me?
Yes.
Okay.
Would you like Havish or Bennett?
Mary Bennett.
Mary Bennett. And then for Commissioner Eggers?
Lisa Havish.
Commissioner Justice?
Havish.
Commissioner Long? Commissioner Long, can you hear me?
Sorry, I didn't realize I was muted. Mary Bennett,
Commissioner Peters,
Mary Bennett,
Commissioner Welch,
Elisa Hevish,
and Chair Gerard.
Mary Bennett,
And I have 4 votes for Mary Bennett and 3 for Alyssa Hevish.
okay, all right. Okay, item, oh, well, that, County Commission new business items. Yes, Commissioner Eggers.
Yeah, I just have a quick comment, and I'm really mad at Dave Waddell for taking away what I was going to say, essentially, because I really don't want to get into it during the budget session tonight. But I'm looking forward to the conversations that we're going to have in the coming year regarding our county lands, whether it's for job opportunities, employment opportunities, and protecting our industrial lands, whether it's for affordable and workforce housing, some of our residential lands, or whether it's our environmental or recreation, some of our environmental lands. And I think we've got a penny for Pinellas in front of us. We've got some money set aside in the environmental category, which I'd like to explore a little more. I'd like to, and I know there's some discussion, there's some other dollars for other pieces of land for maybe stormwater and that kind of thing. So I'd like to have that kind of, I know we're going to at some point, and that was my only emphasis point, was just that we get that conversation a little earlier than later to talk about the different demands on lands in the most densely populated county in Florida. It makes it tough, and it makes for a delicate balance between all of it. Certainly on the environmental lands and the Gladys Douglas Hackworth property, that's been elevated immediately because of timing. And but there's a lot of conversation around that, and certainly I support that effort. But we need to have that kind of broad conversation on lands in Pinellas County. So that was my only comment. Thank you, Madam Chair.
Commissioner Peters.
Thank you, Madam Chair. I want to acknowledge it is National Forensic Science Week, and I want to thank our medical examiner's office and the Sheriff's Forensic Unit. They do an outstanding job. And I also want to echo one of our callers today. Brian, you have done an outstanding job. Thank you. You just stay so calm and perfect and professional, and we don't thank our staff enough. So thank you for what you do.
It's an honor and a privilege. I appreciate it.
Commissioner Welch.
I would echo Commissioner Peters' comments, even though Brian is a Florida Gator. I found that. But nevertheless, good job, sir.
Thank you, sir.
Just real quickly, I saw a Facebook Live on TAN Talks yesterday with members of the Clearwater Urban Leadership Coalition. And I know many of us and Commissioner Seal and others have talked to that group on their CRA proposal, and that's moving forward. Had a conversation with Mayor Hibbert, and he's supportive. And I understand that's going to the city in October. So just want to congratulate them on making progress on that initiative. And finally, as you see from my flag at half staff, just wanted to recognize the passing of an icon, Supreme Court Justice Ruth Bader Ginsburg, on her passing. Just a phenomenal woman. Just wanted to acknowledge her as well for all she's done for our nation. Thank you.
You're here. Okay. Anybody else for right now? Okay, see you at 6.
All right, Madam Chair.
Thank you.